possible that whole idea that is healthcare management, which typically entails like hospital administration, which is not anything useful. So the good part is I have been able to find a couple other training courses that people are putting together, sort of like what we're doing here. And I was able to speak to the two of them that I was looking at, and both of them agreed to let me use some of their materials so that we're all on the same page, because they said they found the same thing, that it just isn't out there. So if we're not sort of creating it along the way, it's very difficult to find it. So basically what we're getting today is a compilation of everything I can find today and next week. So hopefully you find it and useful, but also it should make us struggle a little bit. So I'm warning you ahead of time when we get to the Excel sheets, a little anxiety probably for all of us. It'll be I'm just new to getting used to doing it myself, but I hope that if we walk through it and you can take it with you, then you'll have a template that is useful. So today we're going to start talking about documentation. I'll go through the objectives here quickly. We want to talk about being able to identify your budgeting method. Last week we talked about like what type of budget do we actually work with, and so this week we'll talk about what do we do with that, when we start over. And then we're going to learn how to calculate a simple variance analysis, and that one's not too much consternation, so we can handle that one. It's pretty simple, but very effective. And we're going to talk about how do we implement budget cuts effectively, otherwise known as adjusting your budget. And that's the worksheets that's going to sort of give us a whoa, what are we doing here? But I think that will be really helpful to show you some sensitivity analysis type tools to look to see like where can we cut things and where do we need to leave things alone, or what is the most useful, and maybe if we have to do cuts, how we can explain to staff and other members of the community, stakeholders, that kind of thing, why we went that route with cuts, because we don't just usually cut across the board. I mean, we can do that, but we don't typically end up doing it that way. So we'll look at kind of what that would look like if we tried to do it on our own. And then, of course, we're going to start with recognizing the importance of documentation, because when we're talking about grants, there's nothing more important than that. So I gave you some homework. Did you do it? That's really the question here. I hope you did. How many of you actually were able to connect with or found out who your financial person is who maybe didn't know it ahead of time? Anyone?
Feel free to put it in the chat too.
Well, I know, but was not able to connect with.
Okay. So I just want to make sure we're refreshing memory as far as that goes. If you haven't been in contact or don't know who that is, I mean, if you've already been meeting with your financial person, that's great. Continue to do so. If not, you're going to see even more. I'm going to keep saying that today, so that doesn't go away. So hopefully you guys have identified your budget and what you're actually working with, and started to think about your financial person, whether it be a financial specialist at the state or if it's your just financial officer in your health department. Okay, so documentation. Here we go. There's several things that we want to do documentation for, right? So we want to be able to manage our project effectively, to evaluate the program or project results, for information to disseminate. We want to be able to inform people, stakeholders, the community, all of those things, and to be able to provide guidance for replication and evidence to ensure that we can continue. That's that sustainability piece that we started to talk about a little bit last week, because that's our overall goal here, right? Is not only to do our program now, but hopefully maybe to even expand our programs, but for certain to keep it going, right? That sustainability factor is important. So we want documentation. So it's not just paperwork, right? Like, again, none of us likes paperwork. I get that, but we have to be documenting all the things that we're doing, because if we're not, it's hard for us to have the pieces that we need to make justifications for all of these things that I just mentioned. Okay, so it's really important when it comes to budgeting, especially because last week, remember when we talked about how your indirect costs and whatnot typically come from you submitting what you think you have going on, and then they make a judgment call based on that. And so if you're not giving them good information, if you haven't documented everything to be able to sort of show that, it's going to come back to bite you later, right? So we want to just make sure that we have the bases covered with documentation. So that first one that I talked about is managing the project effectively. If management of the project is to allocate resources, remember time, money, things, that was from last week, we need to know what the resources are. Okay, what are the resources that we actually have? So we need to sit down and think about this, because some of us are just sort of going through the motions of this is what we've always done, this is what we have, but do we actually have it down? What what are our resources? We need to know what the activities are. What are we doing? Are we having fundraisers? Do we have a special event? Are we out in the community at certain things? In what order do we do those? At what times? And what do we need to do those? What have we used in the past and where do we go in the future? Okay, so we're never going to remember all of the things. And to manage efficiently, we need the information that we need to make the decisions. And you don't want to waste time. You know, all of us are like, oh, I remember that. It's no big deal. We do this every year. But we don't, right? It's always best if we can sit down after you've done an event or you've, done a clinic or whatever it is that you're doing within your program, because I know all of you are very different in what you're doing in their everyday life. But are you documenting all the things? And that goes into managing the grant, because as I always have said, number one rule in managing a grant is do what you say you're going to do, right? So whatever is part of that grant that says that you're going to take this amount of money and do these things, you want to make sure you're doing that. And you can justify that you're doing that if you have documented well on the resources and activities that you've been doing, and to be able to show that. Obviously, for a lot of you, there's going to be an evaluation at some point. Some of it's built in, some of it is grant mandated, some of it is government mandated, some of it you just want to do to make sure your program is working effectively and efficiently and hopefully equitably as well. So if the management of that project is doing that, even if you're not going through a formal evaluation process, you're going to have to give the grantor a report at some time as to how you spend their money. So this might be just an end of project report. It might be a full-on evaluation, but they're going to want to know specifically what you've done, right? You are going to want to be able to say things like you had 25 community training sessions with a total attendance of 8,450 adults, which is 36% of the population. And you can't make statements like that if you don't have the documentation that you can extract and tally those numbers. So evaluation just can't be done without documentation. Okay, so that's the first thing. We know at some point we're going to have to do this. So when we're managing those grants, we have to document all the things. Okay. Also, we want to document for this information to inform, again, stakeholders. What are we going to tell the public or our actual stakeholders from the grant? How are we going to tell them? What kind of information are we collecting that we can present? Are we going to need to do surveys or interviews? What other kind of documentation needs to go with this? Because grantors are going to make this your responsibility, right? Part of what you're doing is to take what you have, use the money that you're given, and then be able to go out there and tell people what it is you're doing. You want to be able to grab more people if necessary. And how can we do that? We can do that by documenting all the things that we're doing so we can show. It also will help us because maybe we all know that we don't want to reinvent the wheel if we don't have to, right? So if our program is working and we can document it and show that it is, it gives us an opportunity for other people to be able to use our model. And maybe we have taken a model from someplace else, and that's the same thing. We want to document those pieces and be able to show that we're taking the steps. What are we doing differently? It's most useful, again, in public health, everybody's in this together. So the most that we can do is lean on one another, just exactly like I said. I reached out to those two in their training courses to be able to make this one better for pieces that I did not have information for. So the best thing we can really do is to start looking at how do we replicate the programs that are working, and we can do that through documentation and showing the importance of why do we need this program, why is it working, where does it need fixed, and it also helps us to justify, our budget. So to ensure that continuation, right? Grantors make grants for lots of reasons, right? They want to fund projects to solve problems. If that's the case, they expect that you're going to find a solution even after the grant is over. So there's that sustainability piece, that continuation. So what other sources of funding are you going to be able to come up with, and how can you justify that you need it, right? So one aspect of that is convincing others to support the project after your particular grant money stops. Now, some of you are saying, well, I'm grant funded from the federal government. Well, we all know that's risky business, right? We talked a little bit, I think, last week about administration changes and how that can trickle down, whether that be at the state or the federal level, especially if we're talking about funds that are matched by the state governments that continue to trickle to us. We all know that that can change on a whim. And so what other sources of funding do we have so that we're not stuck in this rut of having to cut people or time? We don't want to get to that budget cuts part if we don't have to. So when you approach these groups with a request for funding, they're going to respond more to facts, right? Not, oh, we really need this money because this program works good. So if we can show them something like a $10,000 investment in the project is going to prevent $200,000 in future medical expenses in our communities, then we've made a sale, right? So we do this with presenting what we have and when we can show people, and all that comes from our documentation. Okay, so who documents? Right, everybody who's involved in the process of that should be doing so, right? If you've got staff that's working with you, if you've got somebody that you report to, if you have volunteers that are working, everybody needs to be able to do that. And you want to keep it straight. Of course, you want to modify this depending on who out of this that you have working for you. And there needs to be a connection for that. You need to be having discussions on what do they have documented, and what you can do in the process of that. So we can sort of break it down to say, okay, well, we say document everything, but what does that really kind of look like? And so now that we know everybody documents, one of the things that we do during the course of our grant is to document financial transactions. And that seems pretty simple, right? But this is going to be more than just cash transactions that take place as we spend the grant money, right? Don't forget, we also have to worry about events or encounters, things that we're going to have to spend money on, right? If we're going out into the community, if we have something that's going on once a year, like a clinic or a fair, those kind of things. So that's going to look different than our everyday documentation as far as financial transactions. And then sometimes we have to do processes or components, pieces of things that are coming together that were, again, might be normal, just everyday kind of things. We also have to think about those in-kind contributions by organizations, volunteers. We need to think about our indirect costs, all of those kind of things that we're talking about. We want to make sure that every piece of anything that has to do with financial transactions is there, even if it's something small. So I know we have, we talked a little bit last week about the miscellaneous aspect on our budgeting, and that we don't want to make that a large fund. We don't want it to look like the slush fund. We want to make sure that we're keeping that simple. But even when we're doing petty cash, right? Like if we have to send something out for $20, let's make sure, because later when you have to track down that $20, it's going to drive you crazy if you don't have that documented. And just that receipt in the drawer doesn't cut it, right? You want to put that on a sheet somewhere and get that into your Excel sheet, and make something that's running like you would if you were at home, right? Just to make sure that that looks that way. Okay, so we talked about cash, we talked about in-kind and project activities. Okay, so these are all of the things that could have some sort of financial tie to them. And this could be even if it's revenue, right? So it might not be spending money, it might be if you're taking money in. So for sure, the most important thing that you're documenting is all of the financial things. But that's not the only thing, right? Obviously, salaries. This occurrences and events. These are used to describe project activities that take place like randomly, that are like a few times and that extend over a relatively short period of time. So like an example would be if you had a grand opening or a gala or an open house, right? What are the things that are coming in the future that might either cost money or make you money? And do you have a system in place to be able to sort of capture what's coming up as far as documentation? Some of us get, I would say all of us, get super excited if we get to do a new event, right? And there's so much planning and people are doing all the things, and we just sort of get caught up in doing it in the moment. And then afterwards, like I said, we're going to think we remember all the things that happened and we didn't. So we really want to be documenting if we're adding something new or different when it comes to managing our grants, because if it's out of the normal purview, everything that you're doing should be documented, right? You want to just be super strict that you're writing down all the things, because you don't know if you're going to be able to do it again. You don't know if you'll be the one in the position doing that, right? Maybe you move on from this grant and somebody else has to take a step into that. And we want to be able to set people up to be successful. If we're moving to a new project, we would hope the person leaving that position would help us out. So the best thing that we can do is to remember, and some of you already know this because maybe the grant that you're working with is not the one that you wrote yourself, right? You were given whatever somebody else did, and that's kind of the basket you were handed and you're trying to make do with it. So we really want to make sure that we're covering all the bases and not just, oh, I remember how to do that kind of thing. And then processes and components are basically the things that we do more long-term, right? We call, these are like project activities that are usually take place throughout the duration of the program. And this would be like anytime we have to do mentoring or professional development, if we're looking at counseling or training participants. So we're really looking at things like that, that we want to make sure that we're also, do we have documentation for all of those things? Okay. All right, now, how do we do that? So a lot of the things that I just mentioned have a natural tendency to generate documents, right? So if we have payroll records or canceled checks or test results, publicity materials, if you've sent out flyers or you've got social media campaigns, brochures, questionnaires, all of those are created naturally as a normal outcome or occurrence. And all you really have to do with that is collect it and save it, right? We need a place to keep all of that information so that it doesn't get lost. And so collecting and saving this is really one of the keys to maintaining proper documentation is. So it's a lot of what we're talking about when we look at documenting is really just keeping our things archived and in a place that we can find them. You know, are they in folders? Do we have things that are physical paper copies of stuff, or is this online? Do you have it in a system that if you walked away tomorrow, somebody else could walk in and know exactly what was going on and how to keep it going, right? We know there's a lot of turnover in public health, and I'm obviously not thinking that any of you are jumping ship in the position you're in right now. But again, if there's an opportunity for you to help out at some other piece, right, you're going to want to be able to take that and know that what you're leaving behind here is not going to totally collapse. And I think that's the best way that we can build that community of public health professionals is if we're all willing to do the best that we can for what we're doing and know that when we have to make changes or go wear a different hat and somebody else is going to have to come in and help us out, that we've set everybody up to be as successful as possible. Because again, all of us are really just in this together. Okay, so now we know what, we need to think about how. I said they already do that. Sometimes activities don't naturally create a document. Here is one where we have to like come up with something to collect all the information for our project for later. So if we're thinking about creating documents, we might think of like, how do we do that? What are we looking at? So there are some guidelines that we can do. What information should we include? What are we doing? Basically, documents are just any written record of material that provides evidence about something that happened. So this might be an Excel sheet. It might be a PowerPoint. It might be a Word document. You know, it might be any of those kind of things. Whatever is the most useful, you just have to think about that. You know, if you've got volunteers, do you have some sort of survey that talks about it? Do you have tracking records for them? Are you keeping track of who they are and their contact information? If somebody is donated in kind, do we have all of the information as to how to reach out to them? Are we keeping track of whether or not there was turnover in that organization that's been helpful in the past, that we know if we need to reach out again, who we're supposed to be talking to? I mean, all these things are, we normally are doing them, but have we sat down really and taken a look to see if we're documenting all the things, right? If I asked you all right now, do you have everything in your program documented? I'm certain that some of you are going to say, well, maybe not everything, but most of it. So, you know, if you can sit back and think about what are you not documenting, right? What are we not documenting? So, all right, recap here quickly of what we just talked about. There's 5 reasons to document, right? We want to manage our projects and programs effectively. We want to evaluate the project results. We want to be able to disseminate the information from our program to the public. We want to be able to have guidance for others for replication. And our number 1 goal, right, is for evidence to ensure that we're continuing. So those are the 5 reasons to document. And the 3 categories that we talked about are financial transactions, events and occurrences, and then our general processes are components to our program. So we're going to make sure that we are dotting our I's and crossing our T's, right? That's the whole goal of documentation. And why do we want to do that? Because part of it is that we have to handle the money, right? We're in charge of, you are a steward of that grantor's money, whoever that grantor might be, or maybe multiple grants that you're juggling in like balls in the air, right? So obviously when the grant arrives, you're either getting it through text or electronic transfer, you know, your systems are all set up differently. Maybe you're in charge of the financials. Maybe it's the whole financial services department. Maybe it's just the one little accounting person that you sort of have. Maybe it goes out to the county. But you want to make sure, right? You want to make sure that where's that going? what's the account, who has access to it, who's going to pay in and pay out of it. If you're more in charge of it, whether or not it's actually being the accounting, right, which means double entry bookkeeping, which means you have to do debiting and crediting on both sides, and that gets super complicated, right? Most of us don't want to do it that way. And for most of what I'm showing you, we're not doing things like that. It does get complicated, and most of us don't do that. We don't think like that on a regular basis. And you can do it either way. You just need to sort of make sure how that's going to look when you're coming out of it, right? Simple things like if you're putting something in your budget, do you take it out now when you spend it or when it actually comes out, right? That's the difference in that accounting. Like in an actual accounting system, what would happen is that you would take it out now and put it back later, or vice versa, right? So it would come in as a debit and a credit. So, typically, like let's say you're doing your personal checking, like for me, as soon as you spend it or as soon as it goes out the door, like most of us don't write checks anymore, but let's say you wrote a check, right? I want to take that out of my account in that moment. I don't want to wait till that check clears and then take it out. But when you're looking at accounting, we sort of do it both ways. So you really want to know how that's working, even if you're not the person that's handling all the financial stuff. This again is how come it's really important to sit down with your financial person and say, okay, walk me through this. Use the last year's worth of information and say, tell me when the grants hit and how do you distribute this? And are we ever in a cash flow problem? Do we see places where I need to shore up some funding, so that at the end of the day, we're able to just sort of bring that in, right? We want to make sure that that's the whole thing. We want to know that grantors really require a budget that has several line items, often divided into those direct costs and that we talked about last week. And then also those line items, that's sort of our program budget. And it tells us how much we can spend on each direct expense. And then the budget narrative provides us exactly how the money is going to be spent. So some of you, I think, have probably written the budget narrative to go with your grant. Some of you have not. So we'll talk about that next week. I'm going to introduce a little bit of that at the end of today, just to get us set up to make sure we all know what our assignment is to show up with our materials for next week, because it's really important that the budget narrative, is expanded a little bit. We don't want to just check the boxes on our grant applications or renewals. We want to make sure we're clearly stating that's going to help not only to justify why we need the money, but it's also going to help when we're talking about whether or not we want to increase our funding, and to give us some reasoning that we can sort of show them that we know what we're talking about, for one thing, and that we do have some clearly stated objectives for what we're doing. All right. We want to make sure that we're making everything by check, right? Obviously not cash. Of course, if you have a petty cash or small purchases, typically under $20, anything over that, you don't want to spend any money on without going through the proper channels, because we want that documentation, right? We don't want to be collecting up those receipts and especially spending money that's not. We want to note if that's petty cash, and every time you do it, we want to get a receipt. We want to make sure and where's the folder for that if we have to spend petty cash. And again, not all of you are using that. We want to make sure that we're keeping authority to spend money. Who is in the process of that? Are you able to do that? Do you get to expend things? Can you write the checks to do the things, or do we have to go through the proper channels? And what does that look like? We never want to have, more than a couple people with the hands in the cookie jar as far as that goes. And hopefully that we have to have either your financial services is doing it right through their office itself, or if you're doing it, do we have some sort of system in place where it requires 2 signatures? I mentioned last week that I had been the treasurer for my son's basketball booster. And one of the things that we were required to do as well was that when I signed a check, somebody else on the board had to sign it also, which, can seem like it's sort of a pain, but it's nice because it keeps everybody accountable. And I didn't have to worry about a check that was going out that somebody was going to question me about later. So you just want to sort of see who's responsible for the money, and where do you go if you're trying to track something down? How do you find out if something's been paid? What are you knowing about, your grant managing money as a process as a whole? And of course, documentation on any kind of expenditures, right? We already talked about that it's not just paperwork, right? It's not just busy work. These are important things. This is how you protect yourself, right? If you have complete documentation of all of your financial transactions, if you get questioned about who or what or why spent the money, you can show where all the pennies went, right? You're safe. And then grantors, they worry if people can't produce this documentation. So you really want to make sure that you're on the right page with that. If documentation is missing, there's usually one of two reasons. One, that the money was spent in a way that the grantee did not want, or that you don't want known to the grantor, or that you're just not documenting, right? That you're not doing the thing and you're not handling the finances properly. So you really just want to make sure you have a record of expenditure and you keep up to date in that. So we've kind of looked at finances from the viewpoint of the grantor. What are they expecting out of you? But don't forget, for a lot of you, right, it's government or organization that you're answering to, whether that be your LHD or whether that be the government entity. And they're interested also in how we handle the money, especially if you're working under a public health officer or you are the public health officer. Either way, right, you're going to want to know what's going on with all of the programs and projects that you have under there. And you're also going to want to fight for funding, because we all know that there's only so much money to go around, and you may have to do so within your own departments. So you want to keep all the things that you possibly can for that financial stuff and show that you are being a good steward of the money, right? All right. So those regular financial reports that detail the current balance in the grant account, the balances and the budget line items. You want to do this at least once a month. If you're not really keeping track of all the things that you're doing, you want to do this just for yourself, even if you don't have to turn something in, right? You would do it just like you would if you were at home. You want to see where you're at. You don't want to just wait till the end of the year and then hope it all works out, right? I mentioned last week the importance of knowing what your indirect costs and if they're hitting the way they're supposed to. Are they changing at all? Is there a way that you can find out if they're changing before you get hit with something at the end of the year? Do you have something coming up that's going to make a change? When we get to that adjusting the budgets, we want to see if in fact we can make changes, because we know what's coming up in the next sort of fiscal year that we can eventually then forecast out, which we will cover a little bit more next week. So we're going to start with talking about adjusting the budget this week and then look towards projections a little bit next week. So this financial reports represent the financial life of your project and how healthy that is. We can use that information to sort of gauge how well, how efficiently we are managing that money. And if there are problems or places that we can make cuts or we can shore up funding or we need to look for additional funding, that helps us. There should be one there. And then of course, payroll. There's a lot of possibilities for this. I'm assuming that the majority of you are not have an organization or somebody in your actual payroll department that's handling all this, so that you're not in the weeds with trying to figure out how to do taxes and all of that kind of thing. But just in case, you could have the project is set up with a payroll office. Some of you may be contracting with a service provider. I know that there are several counties that actually contract services that are for the whole county, right, as far as financials go. And so those people may not even be in-house with you. So in that case, you may have to go outside of your health department to be able to talk to your financial person. So that's going to, you're going to have to make some time for that and schedule that. You may have to turn some paperwork in. So do you have to turn in, timesheets? You have to say, who qualifies for health insurance? Who qualifies for these benefits? Do we pay all the amount of taxes, right? We've got the FICA and the SUDA and the FUTA. We looked a little bit about that. Those are healthcare, insurance, retirement plans. So all of those things have to come out of your grant account. And, that's a lot of that is fringe, but some of it is paperwork. Are you getting all the things in that you need so that they can be issued their, W-2s and W-4s? Do we have all of that recorded? Do we have our payroll tax deposit receipts? So we don't want to be caught without having the stuff that we need for that to be done, because if we're going to have to be audited, or if we have to, have some sort of accounting done at the end of the year, we want to make sure that you're covering all of that stuff, because we may have to transfer funds internally, all of those things. So you want to have some sort of personnel reporting checklist. Okay. All right, so we want to also make sure purchasing services know exactly what you want. So if you have to contract out for something, right? You want to say, okay, here's what I'm looking for. Here's what we're going to do. You want to create some sort of job specification document, right? And this will just be detailed to whatever it is. Like if you're getting a bid for something, right? We want to get out there and do it because that's what helps make us more efficient and effective and equitable in what it is that we're coming after. And so we want to create this job specification. You want to get those bids to incorporate that. Who are we going to get to do this? You know, how are we gonna, and this doesn't have to be like construction projects, right? It can be about anything that is helpful for us. Is there more than one way to do this? And do we have opportunities for more than one type of person or organization? You know, we want to make sure that we're covering that so we can justify why we picked the thing that we did. We want to make sure we get our references and respond to that bid in writing. You know, no calling up the buddy down the street and saying, okay, we're picking you. We want to make sure that that's got something in writing, again, back to that documentation. And then watch over the work and don't pay anything until, you know, the work is done. Or if you set up some sort of something to pay along the way, right? You want to make sure that whatever services that you're having to contract out, that you are covering the bases. Okay, so we're just about done with this background information so we can get into some budgeting type stuff. I want to look at some financial management maxims. And these are sort of the list of things that we need to keep in mind. And there's a couple slides here that give us just some things to think about as we're going through this kind of thing. And this comes from this Grant Winners Toolkit book. It's been around for quite a while. So you want to first comply with our organization's financial policies and procedures. So wherever you're at, whether that be at the local level, or at the state level, you know, what are you supposed to be doing as far as documentation and tracking your financials? So we want to start with, where are we right now? Okay, how are we doing that? We want to spend the money the way we said we would, right? Like if that budget narrative, if it doesn't say, or if our actual grant application, if it doesn't have a budget narrative, which it will next time, if it doesn't have those kind of things, like what do we tell them we're going to spend the money on? And particularly if you have been put in this position that you did not apply for this grant yourself, be very careful that you are going back to look at the specifics of that grant to see, are you spending the money the way that you said that you would, right? That is your number one job when you are given that grant money, is to say, okay, I'm going to spend it XYZ and stick to it, right? If you have to make any adjustments for any reason, you need to have permission to do so before you do so, okay? So you want to make sure you're documenting every financial transaction, no matter how small. Use professionals for any jobs that you're unsure about. And of course, outside of your organization, what do you have to do for the state, for the federal, for your local government? What are your obligations as far as the money goes there as well? And these are just some reminders. Be thorough. Make sure you've covered everything. You want to be on time. That means like your paperwork. Did you get everything into the people who need to do it so that people can be paid on time and can continue to do the work? You want to be prudent. Obviously, you want to be honest. And when in doubt, ask that grantors either contact the grant itself to make sure you're staying within the lines of what you need to do, or that fiscal officer, right? We realize now that that person is going to be our new best friend. When in doubt, always ask, okay? So that's just sort of the baseline of what we want to think about in terms of all the other pieces that we're doing. So managing the grant, a lot of it is really just, okay, do I have everything I need in front of me? Have I documented all the pieces? Do I have what I need to start doing some of these other things? Which is, you know, we're going to talk a little bit right now about types of budgeting and what do we do like for the next year and the year after that. And we have to just be able to identify where we are to begin with. So I think it's just a good idea. I hope all of you will take some time and just sit down, you know, with your grant itself, you know, with your budget and think, okay, what do I have here? Do I have all the pieces I need? Is there something missing? Am I able to implement some of the things that we're talking about, or do I need to collect more information before I can move forward? So let's talk about the different types of budgeting, because everybody loves budgeting and financial management, right? Yes, that's why you're here. So we're going to spend a lot of time talking about that kind of thing. So first of all, we want to talk about the different methods. So there are four, right? There are four that we actually look at on a regular basis. And some of them are used for different reasons. And you are probably doing one of these already, but this is a good time for us to identify which one you're using And 2, is that the one you should be using? And 3, is one of these other ones better for what you're trying to do? Okay, so we're going to talk about each one of these individually here. So we'll start with this incremental budgeting. Incremental budgeting actually takes last year's figures and adds or subtracts a percentage to obtain the current year's budget. And this is probably what most of you are doing. It's appropriate to use if the primary cost drivers, remember those things we talked about last year, those cost pool, or last week, seems like a year, doesn't it? Anyway, the things we talked about last week in the cost pools and the cost drivers, we want to make sure if they're not changing year to year, we know that that is something useful, and it is the most common. So maybe you're doing that, and some of the things that we'll look at sort of do projections in that way. Like they look at this year and they say, okay, we're going to have 10% increases in these things and probably 15 in that based on what the market is. Some of you may just be like, okay, we're going up another 10% across the board. And next week, we'll sort of talk about how would we decide that piece of it. But a lot of you are probably using just this incremental budgeting, maybe takes into cost of living or inflation, those kind of things for when you move your budget forward. So it is the most common. And again, as I mentioned, appropriate when cost drivers don't change. But as always, there are some problems with using the method. It's likely to perpetuate inefficiencies. If a manager knows that there is an opportunity to grow his budget by 10% every year, he's simply going to take that opportunity to get a bigger budget while not putting effort to seek ways to cut costs or economize. So if you know that there's a funding stream coming that will allow you to ask for 10%, then are you really being frugal with the money, right? Maybe not. So incremental may lead to some inefficiencies because we just sort of do it, right? It's likely to result in budgetary slack. So a manager might overstate the size of the budget that the team actually needs, so that it appears that the team is always under budget. So if you ask for more money and then don't use it all, right? We have this budgetary slack, then you can say, oh, look, we're under budget. Oh, look, we're under budget. We don't want that either. We also don't want to be under budget and then try to be spending all that money at the end just so we can continue to get the funding that we've been receiving, right? That's always our biggest fear. It ignores external drivers of activity and performance. For example, if there's very high inflation in certain input costs, incremental budgeting ignores any of these external factors and simply just assumes that costs will grow like by 10%. And if we have paid attention at all to the world that's around us, we know that we're worried about inflation and sort of like economic issues out there. And so if you're doing budgeting incrementally, this can be a problem for you when we can see that the world is going through inflation because it's going to cost us more, right? And if prices of things go up, so do the things that we have to spend our money on as far as supplies and services, and also as far as like our indirect costs and maybe even our direct costs. So if all of that goes up, then you're going to have to be able to take an account for that. And can you really do that when you're incrementally budgeting if you're not stopping to look at that macro level and back up away? And there's big words for us, right? Macroeconomics is looking at the big picture, right? So the next way that we can actually do budgeting is through something we like to call activity-based budgeting. And this is a top-down budgeting approach that really determines the amount of inputs required to support the targets or the outputs set by you, okay? So if we set an output, let's say something large, like $1 million in revenue, the company or you guys are going to first have to determine the activities that need to be undertaken to meet that sales target and then find out the costs. So again, if you are more activity-based, if you're more hands-on, if you're out there, you're providing clinics, let's say, if that's what you do, right? Those are activities. And so we want to look at how much is it going to cost and how much is it going to bring us in? And we need to make sure that's matching, right? So that may be activity-based budgeting that we're looking at. What are the activities that we need to do? How do we make money? How do we come back to that where we're not having a deficit when we're finished? The next type is what they call value proposition budgeting. And in this scenario, the budgeter considers the following questions, okay? Why is this amount included in the budget? Where do we get that from? Does that item create value for the customers, the staff, or other stakeholders? Okay. Does the value of the item outweigh its cost? If not, then is there another reason why the cost is justified? So it's like really looking at the value of the things that we have in our budget. Do we have to have these things? It's really a mindset about making sure that everything that is included in the budget delivers value for the project. Value proposition budgeting aims to avoid unnecessary expenditures. And it's not as precisely aimed, though, as the goal of the very last one, which is what we call zero-based budgeting. So you may have heard of this one, or incremental budgeting. This is one of the most common. Zero-based budgeting starts with the assumption that all department budgets are zero and have to be rebuilt from scratch. Managers must be able to justify every single expense. No expenditures are automatically okayed. Zero-based budgeting is very tight, aiming to avoid any and all expenditures that are not considered absolutely essential to the successful operation of your program. This kind of bottom-up budgeting can be a highly effective way to shake things up, right? So if you had to start with $0 again and justify to me everything that you're going to do for the next year, can you do it, right? So this is a really good approach to use when there's an urgent need for cost containment. So if you're going through some sort of financial restructuring, or you know that you're going to lose some grant funding pretty quickly, or it's going to be cut tremendously, this is a good tool. It's a bottom-up approach, and it can be used for that kind of thing as restructuring when you want to make a dramatic change to your budget. It's best suited for addressing discretionary costs rather than essential operating costs. It can be really time-consuming, like a lot of the things that we talked about, right? If we could do anything, we would ask for more time, right? So we don't see people using this on a regular basis because it is very difficult to start from the absolute bottom at the beginning of a year and get to that whole point. We want to just say, but again, even if you're going to use incremental for the most part, is something coming on the horizon that makes you nervous that you could say, okay, wait, if I had to start over, what does this look like? Do I have the amount of people that I need? Do I have the supplies that I should have? Are my indirect costs too high? Are my direct costs too high, right? Where are the places that we might be able to make some cuts so that when we can sit down and use the tools that we're going to talk about in a few minutes, do we know what we're even trying to do here? And so we see for the most part that people are using incremental or zero-based or some combination of the two. Now, we've talked about the different kinds of ways that we can look at our budget, the types of budgeting, but we also want to talk then about the levels of involvement in the budgeting process. So who's coming with us? Who do we have to include when we're doing this? Do we get the authority to say, we're going to zero-based budget next year, or we're going to do incremental budgeting? Do we have that option? So we want to sort of think about this. What are those levels of involvement in the budgeting process? We want buy-in, right? And acceptance from the whole organization, whether it just be our program under our department, our whole health department, is it the state health department, is it the government, is it our community? But we also want this well-defined budget and one that is not manipulated by people, right? We don't want anybody really involved in what's going on that shouldn't be. There's always a trade-off between goal congruence and our involvement. Okay, so there's these three pieces that we have on the slide here that are outlined, and we should think about it. Do we have imposed budgeting, negotiated budgeting, or participating budgeting, right? So for imposed, this first one, it's a top-down process where executives sort of adhere to the goal that they set for the project, and managers follow the goals, and you impose budget targets for the activities and the costs. It can be effective if there's new goals, or if you've got some turnaround, those kind of things, where it's like, here it is, and this is all that we've got, right? So it's top down, here's what you're going to do. And this may have happened if in particular you've stepped into a new program that is grant funded. The person who is above you or overseeing you may be using your budgets. I know I've had students in the past who are technically program managers, and their health officer they don't know anything about their budget. Their health officer does all of that. The health officer keeps it very tightly knit, and the program manager doesn't even know where their money's going. That's bad, right? I mean, that's that type of imposed budgeting where it says, here, you just do the things to run your program, and you don't need to understand how it actually works. So if you're in a position where you're not doing this financial stuff, right, I would hope you could sit down with your public health officer or whoever is in charge above you and say, hey, I need to see how this works. I need to see where the money's going and how can I get involved in this process. The next one is negotiating budgeting, and it's a combination of both top down and bottom up. Executives whoever's in charge might outline some of the targets that they would like to hit, but at the same time, there's this shared responsibility for budget prep between managers and employees, and between whoever is above you. This increased involvement in the process by you, right? Maybe you are the person that is underneath somebody else, or maybe you have people working for you. So let's sit down and talk to the people who are actually implementing the program and talking about whether or not we're budgeting the items in the right way. Are we hitting our targets just because that's what the budget looks like right now, or do we need to be able to assign new targets to that? If you can involve the people that are working on your program, there's more of a personal interest. And anytime we can get people to plug in a little more and feel like they're being heard, that's going to help us on the turnover, right? We want to make sure that we're including and being involved. And so if you are in a position to include people, you want to do so. If you are the person who needs to be getting included, you want to do so because you don't want to push yourself to the edge where you feel like you're not involved enough with what's going on, or you're wearing too many hats and don't even have a clue as to what you're supposed to be doing, right? That's going to cause burnout and turnover. And we want to make sure that we are not doing that in any way that we possibly can. And then this last piece of it is what they call participative budgeting. It's kind of a roll-up approach where basically any of the employees work from the bottom up and recommend the targets to the executives, right? To the people above you, to your grant funders, to the stakeholders. Maybe those people can say, well, that sounds great, but we can't do that because of X, Y, Z. And then you can work together to find a solution. Either you can't do it, or maybe you can go look for additional sources of funding, like the things that we talked about last week, where you work out to 501c3s, or you reach out to 501c3s, or you look into the community foundations. So, but having discussions about exactly what it is that we're trying to do here with the people that need to be at the table, and including those people. And then we can sort of look at where we can go from here, okay, and be able to recommend targets. I also want to talk a little bit about, so sometimes in the real world, right, we have these silos. And so the business world has their terminology, and nonprofits have their terminology, and governments have their terminology, and it can be sort of a mess. And we're like, wait, what? So I just talked a little bit about this involvement in the process and use the term participative budgeting. We also have a thing that we like to call participatory budgeting, and this is like in a little bit of a different context. So I want to talk about this in case you have not heard about it. Let me go back here. So what is it? Participatory budgeting is a method that includes community members in decision making. It involves gathering members of the community together to discuss key health challenges that you guys in the community are facing, for them and for you and for everyone else. And then using that discussion to develop proposals that should be funded to address them. So some of you might be thinking, well, this sort of sounds like a community health needs assessment. And yes, that can be true. It's the next step to that. If we've identified those things, but if we engage the community in the public health process and talk to them about where we want to spend our money and why, if we can walk them through that community health needs assessment and say, look, we've identified X, Y, and Z that are important to us, and here's where we need to start spending some money. And that would maybe give you an opportunity to reach out to some of those other places that we talked about last week, or maybe even look for additional sources of funding. So what are some benefits to doing this, right? It provides an opportunity for the residents to see themselves reflected in municipal priorities. So what are we trying to do as far as the public health, right? We can think about maybe the intervention ladder, if some of you are familiar with that. How much are we trying to give them information? Are we educating the public with our program and our priorities? Are we trying to, change their behavior? Are we guiding through incentive or disincentive? Are we taking away their choice altogether, right? And are we having a conversation with them about why we're doing these things? And so this idea of participatory budgeting sort of lends itself to community engagement as well. Projects that are implemented are usually up to date and informed by these community needs and their priorities. And the community voice directly influences and shapes our decision making. So that's great because we have some justification for what it is that we're continuing to do. We're not just walking in saying, hey, we're the public health department. We know what's going on. We know what's best for you, right? People don't like to be told what to do. We all know this. So how do we get out of that idea and get out into our community? It gives a voice to those who are typically left out, right? Residents can understand how government processes work and how the decisions are made, what gets funded, they can help to go through that process themselves. And this is especially important if we're in communities where we have non-English speakers, people who have been formerly incarcerated. Like these are the people who need our programs. And are we working with them to ask what they need? And when they tell us what they need, are we giving them a way to do so? Right? If we put a form out there and we've talked to those that are not English speakers and they've said to us, hey, part of our problem that we don't have access to care is because we don't have anybody who speaks our language in your community. Well, when you see that, what are you doing with that? Are we working towards projects and programs that reach that goal? And are we working with them to give them what they ask for? And are we asking people for additional funding that have that same goal in mind? And stakeholders, in this case, when you're doing participatory budgeting, you could include schools or school districts, local foundations. They might understand better this community needs aspect and help develop longer term intentional projects in these areas. And of course, with everything, if there's benefits, there are some challenges to come with that. Not all governments, foundations, community-based organizations want to give up any kind of decision-making power and authority to share it with community members. It's unfortunate, right? It's unfortunate that some of our people who are in positions of power like it that way and don't really want to share. They don't want to involve that. So, if you're going to open up the doors to community, besides doing just the health needs assessment, if you're going to ask them about things that they want to spend their money on and help you to get additional funding, you're going to have to be cautious as to who you are working with in order to do that. This process relies heavily on meetings. So like in a COVID-19 context, these would be like an additional consideration to make sure everybody had access to Wi-Fi, that meetings could be easily accessible for non-English speakers, because what happens is if you're not doing that, you end up putting the people that you actually wanted to include because you were doing this way, and you're going to leave them out. So we sort of have to think about the context for what we're doing, if that works for us at this moment. Depending on the funding source, it might be a marriage between some bureaucratic and concrete funding and some community-led process. It's iterative, and that can feel unnatural because we've got a bunch of little things going on here. And even if we talk about engaging the community, obviously we can't invite everybody. I mean, if you've got an area of 100,000 people, there's no way that you're going to engage 100,000 people. But you need to at least be reaching out to and identifying what are the groups of people that actually represent your community, and do you have representatives from each of those groups, right? Especially when you want to get engaging those hard to reach populations, and that's going to take more time, right? You're going to have to go out of your way to get to those people that are really the most that need help, right? And of course, it's difficult to do advanced planning. And it can be difficult to reach those marginalized populations, which all of you know, right? And all of you who are working with programs right now that are trying to reach people, I'm certain that there are people in your community that probably qualify for your program, and you can't get to them, or you don't have a way to get them in the door. So we understand that, I think, as a whole. If we're going to look at something like this, some considerations and recommendations to doing this, it doesn't require a lot of funding, because the process is just an intervention. It requires a high amounts of staff capacity and meeting time, but it can be done on a little scale. You can start small, right? A lot of the things that we're talking about here, we don't have to overhaul our whole system. We actually can incrementally make these changes to what we're doing. The process itself is time sensitive and requires humility and patience. If we're going to get out there and sort of work with the community, we can't always think we're the expert on everything, even if we've been working with our program for a long time. And when considering programs or services to fund, resources should be accessible for all the populations that we're serving. We want to make sure that we're not leaving somebody out. Relationship building is critical to the success of participatory budgeting. And we're also going to need to establish relationships and work with critical stakeholders, both internal and external, which includes boards, community-based organizations, schools, citizens, the grantor, right? And it's important to reduce barriers for participation. So are we paying people to join? Do we have transportation for them? Is there childcare available? So that we want to make sure that we don't put up some accidental barriers. So I have an example here of where this actually went into account, and it's from Tacoma, Pierce County, Washington. And they were actually able to supplement their existing anti-racist efforts in Washington to engage traditionally disenfranchised citizens and to create some sort of authentic civic engagement. The Tacoma Pierce County Health Department uses participatory budgeting to empower their community members. So in 2018, the county launched this PB as part of its anti-racist efforts to begin to dismantle systems of oppression and bring the marginalized people to the center of the conversation. The efforts began within 3 schools. So rather than starting in the actual community as a whole, they went into the school system in East Tacoma, which was a neighborhood with historically high health disparities. And the initial participatory budgeting grant was for $150,000. So in an attempt to be intentional and apply this to public health space for the very first time, the money was divided within the schools based on student enrollment, and students who did not normally hold leadership roles were chosen to form the advisory groups. When working with younger students, officials were forced to engage with their parents as well. So the method became intergenerational and was able to engage more than just the target population. And in one of those interventions, high school students focused on breaking the school to prison pipeline. So we're giving it back, right, to that age group. I mean, think about this. So we're going to engage with these students even, and then get to their parents, right? So one of the things that they did that was a super simple thing was that they had taken the mirrors out of the bathroom. Okay. So they restored the bathroom mirrors in the men's restroom because they felt like without being able to see themselves as human in that environment, it was already a type of prison. And this is what they were saying, right? And so the leadership was listening, and that the systems were already seamlessly delivering the experience of this prison, right? So this intervention both empowered the youth, but also allowed the school district and local foundations to understand the impetus behind the Mirror Initiative, which could then act as a catalyst for future more long-term interventions that were focusing on dismantling that school to prison pipeline. Okay, so what were some of the things that they were able to do? The first thing that they did was they gave the subject matter experts in this scenario was the kids, right? Which is interesting because we think about subject matter experts, people have been doing these things for a long time. But if we're trying to help somebody at that core group, are we an expert at being a youth that is in that position? No, we're not. We're not. So we want to make sure that you're giving those subject matter experts the power to make the decisions. So the students were the ones doing the decision making in this example and deciding on which health interventions to implement in their schools. It was the process for them that was the biggest takeaway. That was what they saw in making change. And they were engaging in their communities. And this is exactly the kind of thing we want to happen, because as they become adults and have learned to engage with the community and with public health, if you're getting those communities that have been disenfranchised and marginalized for generations back to the table, right, you're going to flip the power dynamic, which is super important. And one of the biggest benefits of implementing this strategy was giving the community, those who understood the context, the agency to make these changes, right? You were giving them something that they actually needed. And the participants felt more confidence in the process. And there was a trust. And we are at a crossroads right now, right, with building public health trust. So anything that we can do to get back out there in that community and start to build that up. And it doesn't necessarily mean to deal with the people who we think are in power, right? It may very well mean that we have to engage the people who have been without power, right? They actually were able to use different applications of the same model. The initial pilot was in the 3 schools, and then they applied it more broadly in different contexts, focusing on different subject matters. And they went out into rural communities once they were able to do this. And it allowed the health department to work with different populations to understand the health challenges. It was like this nice little marriage between the community and the health department. And then the people within the health department were able to see some of these health disparities that they didn't necessarily know ahead of time. And some of those things were challenges, but they were able to see that they were there. They gave up power and shifted decision-making authority. And so that's one of the biggest things. And of course, this comes with all kinds of challenges. Before this can begin, right, they had to go into the community and listen to them and really interact with what was going on as far as the lived experience of the residents. And this is a long-term commitment. It's not something that we can fix. We can't change our communities overnight. This isn't a matter of like, let's put up a new community something, and here we are good to go, right? It requires giving up power and shifting decision-making. And then that's it for that section, okay? So again, participatory budgeting can be used in a couple different contexts. We can look to see if that's sort of within our organization, right? Is that what we're talking about? Are we talking about participatory budgeting as in we're getting out there and saying, hey, we're going to apply for a grant for X, Y, and Z here. We want all of you who are actually involved with X, Y, and Z to come and help us figure out how we're going to spend this money, okay? And that can be for programs that you already have going on, or that can be something existing that you're going to ask for. It could be something that you write into as a small piece when you're reapplying for the grant that you have, if your program is something that's community-based, okay? All right, so here looks like a good part, because when we come back, we're going to learn how to do a variance analysis. And it's going to require a little bit of math. This is the easier one that we're doing today. So if you guys want to take about 5 minutes, fill up your coffee or your water or whatever it is, and we'll get right back to it.
Thanks, Trisha.
We can get to the variance analysis. So what are we talking about in variance analysis? Okay, there it is. Variance analysis. First, we want to talk about what variance looks like, okay? Variance obviously is just the difference between what actually happened and what was expected to happen. So when we're dealing with our budgets, it's important for us to think about the difference between the two, because as much as we want to have our budget be exactly what actually happens, sometimes that's not the case. And so we can actually focus on what we call variance analysis. And this focuses on the difference between the realized values and our forecasted values. And it's an important technique for controlling financial performance. In accounting, a variance, is that difference between the actual value and a budgeted value, which is often referred to as a standard. So it's an examination and an interpretation of differences between what actually happened and the plan. Remember, our budget is just a plan. And hopefully our budget is based on realistic expectations. And if it's true, if we've done that, variance analysis can actually provide managers with useful information. It doesn't provide all the answers. It's sort of a snapshot of things that are going on. And then you have to dig a little deeper. But it helps you to ask the right kind of questions as the manager of the program, or even as a participant. Variance analysis is essential to the managerial control process, and actions taken in response to a variance analysis often have potential to dramatically improve the operations and the financial performance of the organization. So, for example, many variances are controllable, meaning that they can be corrected by you, okay? So you can take actions to avoid unforeseeable variances in the future. And you're not doing this to assign blame or, finger pointing, right? Any of our tools that we're using are just to help us to move forward and do a better job. It may be because of operational problems. It might be because of the outside market. We have to be constantly vigilant of what's going on around us when we're talking about the money, because not all of the variances can be controlled by the management, okay? So, but knowledge of the variances is essential to the overall management and well-being of the program and the grant, right, that you're managing. It might be necessary to revise plans, to tighten those controllable costs that you might have to do to offset the unfavorable cost variances where you don't have control, right? Again, if the market is driving up some of our costs, do we have to cut in other places because of that? But we don't really know what's going on unless we're keeping track, okay? So let's sort of look at an example of one of these. And this is a dental clinic's first quarter and annual initial expense budget. So this, the quarter's over, and the finance office has provided the manager with the actual expenses that occurred during the period. So to conduct the variance analysis, the manager must compare what had happened in the first quarter with what was expected to happen. Then the manager is going to have to determine any problem areas and take action to ensure that at the close of the year, actual expenses are in line with those projected at the beginning of the year. Now, there's an important thing to note about this budget. Remember last week when I said, are you just breaking it down into 4 quarters, and is that the most useful? Notice that this one is using that 4 quarters techniques. So maybe that works and maybe that doesn't, right? And I think I talked about the immunizations for the flu, which we could even talk about the COVID vaccines type things. Are there places and times that you're going to have to use more of those? And so is just dividing your budget into the quarter system, and maybe you have to report on a quarterly basis to someone, so you have to do this as well. But for you personally, as far as management goes, do you want to do it that way? Do you need to budget things differently, or even if you stay on the quarter system, does one quarter need more or less funding? If you just set everything the same, you're going to look like you're over in some quarters and under in others. And then that's not as useful for you personally when you're trying to keep control of the cost. Okay, so your initial budget should reflect that. But this is just a simple example so that Gopinski is who actually did this. Louis Gopinski, he has passed away now, but he is the forefront of healthcare financial management. So if you ever looked up a textbook that looked in financial management, and he recognized that there was so much information that he has contributed mostly at the hospital type administration level. And so he actually, as part of like the public health on this website here, the publichealthfinance.org, he created for them some just real quick modules. And so these examples have come from there that are set up to be more for the local level to look at. Okay, so we're going to look at this sort of simple variance analysis. And so here's what happens. This next exhibit, this is the first quarter expense variance analysis. So what they did was this. The initial budget was here. So in this particular example, we have the director's compensation, the hygienist compensation, the assistant's compensation, office staff, clinical supplies, office supplies, equipment maintenance, utilities, and telephone. Okay, so this is what they had in their actual budget. And so this first line item here, the first column, is showing what the budget was, right? With a total of $70,006. That's what it was supposed to be. Now, here's what they actually spent in the first quarter, okay? So the second column shows that. Now, they were over because it's $70,643. But if we do an actual variance, so what we do is we take, here's the formula. So it's relatively simple, right? As far as people who don't want to do math. So we can take the initial budget minus the actual results, and that gives us the dollar difference. So anything that is in parentheses is where we have spent more than we budgeted, right? And if we change that into a percent of the budget, right, the percentage of that, then we are actually, so like this $479 divide by the 13,334, and then multiply it by 100 will give us our percentage, okay? So we can quickly look down here to see what's the deal. Okay, so anything that is in parentheses is how they've shown that here is this negative, right, which we saw here. But look at that. That's the percentage of what was budgeted, right? Not the percentage of the overall budget, but the percentage of what was budgeted here. That's, we look quickly and we can see, oh my goodness, it's this hygienist compensation that's really throwing us off. Now, there are a couple other areas that we've spent, you know, and the assistant's compensation, you know, being up 5.6%. Percentage points, I should say, is a big deal, but more so is this next one, right? So what are we doing? So once you have that information, what can we do with it, right? Now, we have shown it here in this example. He has to give the initial budget minus the actual results, and it gives it this way. You can do it the other way around, and you just have the negative sign flip. So however you want to see that, so that you can make that work. Okay. So let's go to the next one and we'll see. Once we get down to these hygienists, right, we see that that was the area of issues, right? So we know that the dentist hygienist expenses were $1,573 higher than we budgeted. So when the compensation is broken down into the hours worked, so once we identify that first piece, we can go a little further and say, okay, wait, what do we have as far as people on the payroll here? What are we doing? So if we looked at the number of hours that were budgeted, and that's how we got to that dollar amount, right, that we were supposed to do it. And the actual results were 545. Wait, that's less than what we said, right? So how is that? Because we have 31 hours here. We didn't even expend. So we were actually up on the hours. But look, if we look a little closer, right? Here it is. Right, here's the difference between what we budgeted at basically $12.22 an hour, and we ended up having to pay, there's that market price, right? That was $15 and almost 81 cents. So that resulted in this variance of $3,000, right? And so here's what we ended up with as far as total compensation goes. So there's where the problem was. So the breakdown into those component factors, once we identified overall that this was the area that was problematic, we can dig a little deeper, and it gives the manager additional information for analyzing the budget results. Now we know that the failure to meet budget was not the results of the hygienist working more. See, because we could have just seen that at the beginning and been like, oh, we just have to cut their hours. We already didn't use the hours that we said, but they were being paid at a higher rate. So to ensure that this negative trend doesn't continue throughout the year, we would have to look at those hygienist work assignments to place more of the workload on the volunteers, because this particular clinic was a combination of people who were volunteering their time and people who were being paid. So if you can't do that, if you can't increase the volunteer hours, then you might have to think about other alternatives. Maybe you can get funds that are reallocated from other resources, some of that different sustainability techniques within or outside the dental clinic. Of course, you can't do that without prior authorization, because unless we are using the grant funds exactly the way we say we are, but maybe there is some sort of reserved or community resource that can be tapped to help meet this unexpected cost, because you are not necessarily in charge of that. If this is the market that it costs to do so, you're not necessarily in control of that, right? Or the clinic may have to come to the part where they reduce the number of client cleanings. So that would, of course, reduce the number of hours the hygienist worked, okay? So that's just a simple thing. And hopefully you will be able to take your own budgets and do the same thing. You can do a variance analysis from year to year, right? You can take your actual results from last year versus this year. You can take your initial budget versus all the pieces from, overall for the year, where were you at? Or you can do this on a monthly basis, right? If you're keeping it up for you personally, even again, if you're having to give a report, let's say at those quarters, if you can look month to month and see where the variance is. There's a lot of different ways that you can actually do this. There is a variance analysis, I do think. Let me look here. Over here. I just don't want to tell you the wrong thing. Okay, you should have in your handouts folder what is called the variance analysis example. So if you want to pull that up, that would be fine. I'm trying to pull it up myself. There it is. Okay. So again, let me zoom in a little bit here so we can see what we're looking at. No, it doesn't want to show us. Okay. All right, so this variance analysis example that we can look at quickly. Notice that we have the expenses, we have salaries, we have fringe, we have payroll taxes. Those are all included things that we've talked about. Then we have our direct costs listed, which is professional fees, rent, depreciation, other occupancy, transportation, insurance, communications, training supplies, and other. And here's our total costs, right? So the first thing we want to do is figure out the difference between the actual and the budgeted, right? Because we can look down here and see that there's a difference. That's easy for us to tell if we just run the numbers side by side. But this is not necessarily useful information, right? Because this doesn't tell us anything about where the problems could be. Because in this case, we actually spent less than we budgeted, right? And that's okay, but we still want to know what's going on. So the best way to do this, right, obviously, is that we can just use our Excel formulas. And again, I know everybody has different levels of use with Excel. So we're going to use some simple things, and we're going to use a few more that are a little more complex as we go, based on using formulas and whatnot. And if for some reason, again, I know this one is not that, but if you're you don't use Excel on a regular basis, or if I'm going too fast when we get to some of the other ones, just be sure and raise your hand, holler out at me, and I'll stop and go back through it. Because the big thing we want to know is that you have in your possession the key, right? And you'll now have the key because we've worked through these things, and that way you'll have it as a basis. Because once you have, obviously the beauty of Excel is that once you input these formulas and do the stuff, you can go back and see what you did. And so you can create then your own copy with your actual budget. So we want to make sure everybody's on the same page and nobody's lost. And again, partly because if I'm going too fast or because you can't see the cells very well, it's totally fine. Please ask me to slow down or to stop or to show you what was in that cell that the formula looks like. Okay, so in this one, it's not so bad. Now these are broken down, so we're going to get some zeros and some no value stuff if we just do it simply. But the best way to do this is just, to say equals, and we'll go with the actual minus the budget. So just click on the cells, right? And then we can hit enter. Okay, so then when we do it this way, we see that if we're looking at what we budgeted, we're over here, right? Because this is actually more than that. And so by doing it this way, we get a positive number. So if you do it the other way, it would actually show you that this is a negative. So you just have to remember which way you're doing it this way. So if we're looking at something that's positive in this result, that means we actually spent more than we were supposed to. If you want it to show up the other way to where it's going to be negatives for you, you want to take the budget minus the actual. Okay. So it's just a personal preference on how the numbers come out, right? So anything that's up like this is over. So again, quickly, we don't have very many line items on here, so we could just do it that way, or we can move to the next part of it and figure out what that percentage is. So, right, so it equals our variance divided by what was actually budgeted. And we want to use, best if we can use our parentheses to put this in here. Times 100 will give us a percentage. Oh, it should have, right? So that's our, yeah, so it is 0.4. So we can scroll it down here. And now we can quickly look, we'll take these ones out of here that will make us not see things very well. And if we run through here, we can see where these variances are. And remember, we're looking for, in this example, the positive ones, right? Because that's where we're over. So we've got like 4% here. And if we keep scrolling down, oh, look, we get in here, we see the training, right? As far as percentage of our the budget that was actually budgeted for that. Again, this is not as the total budget, right? But it is, there's a problem area here because, again, if we just looked at this, we would think that we're doing okay, right? If we just look at our numbers between what we spent this month versus what we budgeted, this would make us think that we didn't have any issues. But we do have some issues. We have some places that we're spending more money than we should be. And if we don't control that, that may end up over the next 3 quarters or next year of costing us way too much money. So we want to be careful that even if our bottom dollar is matching, are all the pieces that we budgeted correct? Because if you're going to have to change those budget projections for the next year or the next cycle or before they get out of control, or you need to say, okay, training is up, we spent more this time than what we thought we were going to, but it's because we added an additional training this quarter and we're not going to have training the next quarter, so it's going to be fine. But you need to recognize that, right? You want to know, is this, what if that's a training that you do 4 times a year? Well, look how much you're going to be up, in 4 times, that's going to be $12,000. And that, even if everything else stayed the same, that $12,000 could put you over your actual budget for the whole thing. And why are you doing so much more in this case? And how come the other ones are less, right? Are they going to make up more later? Why, so again, this is just a really useful tool to get a quick shot of what's going on. And then you can get a little bit deeper in this. And so you can say, okay, hey, training people, why did we spend 53,000 when we were only budgeted this quarter for 50? So it's just a way for you to ask questions. And again, you don't want to point fingers by using these tools, like that's not the goal of this, but it is to help us sort of recognize. And I think this one is a really good example because for the majority of us, I would assume, if you look to see what you spent in first quarter versus what you were supposed to spend, and you saw that you were spending less than what you budgeted, you'd think, wow, I've got money left. This is great. But in fact, you need to already be careful because there's things coming up. Does anybody have any questions about this variance analysis example? And I also hope that you notice when we're looking here that the dollar numbers, right, are not necessarily what we're paying attention to. Because, for example, in salaries, we spent $7,839 more than we budgeted. But as far as the percentage of the budget, that's not much. It's only 0.49%, right? So is that really a problem? Yeah, you're thinking $7,000. That seems like a lot. But again, we want to take into account how much of the budget for that it was. Okay, so that's not over very much. We still would want to know where that $7,000 is going to, right? But we really want to get at the pieces that are going tremendously over. And it doesn't seem like it's so much of a dollar amount, but it matters because you're spending a huge portion of that particular line item budgeted, and you're not going to have anything left for the next 3 quarters if you keep spending like that in that particular category, because we can't just move money from one to another typically, right? Because if we've lined out this budget, especially if our grant says specifically that's what we're spending these things on, we have to be careful. Okay, so notice here that we didn't miss on the fringe. We actually spent less than that, which is good, but we got to make sure that we're paying attention to those things. Because at this time, our salaries are high, but the payroll taxes, we clearly did fine on this particular piece of, we didn't do well on the payroll taxes, sorry. We did fine on the fringe, but not on the payroll taxes. And that's because our salaries were higher, right? So we got in trouble in both areas. So maybe it's going to be okay for us for this quarter, but if we're budgeting for a 3-year grant or something of that nature, we need to take into account of what's going on, and it's not going to be reflected for what our budgeted amount is on a long-term area. Okay. All right. Okay, so another area of training. The training might be something on occasion, but maybe we had to have it, right? So what we want to make sure that if anything is possible, that we can keep that training under key. Okay, so there's no questions about variance analysis. And again, this can be used at quarters, at the end of a year. It can be done on a monthly basis. The more you're keeping track, the better informed you're going to be. And the better informed you are, the better decision making that you can do. Okay, so we're going to get into what we call adjusting the budget, which is basically a nice way of saying budget cuts. Don't need this one just yet. There we go. Did that. Okay. But before we get into doing some more math, okay, I just want us to think about the reason for budget cuts, right? And it sort of seems like, well, it's because the money's not there, right? Well, of course, that's our first one. If we're going to develop a strategy for cutting our budgets, we need to understand the reason that drives the cuts in the first place. Okay, so some of the most common are, obviously the first one, cutbacks by funders or governments. Government funders will reduce funding as revenues decline or policies change or administrations change. A governmental budget deficit is likely to result in reduced funding for nonprofits, right? And any other government organizations. At times, funding cuts will be driven more by changes in policy. An example would be like things like cutbacks in appropriations for the National Endowment for the Arts. Those were driven by congressional skepticism about the government's role in funding the arts. So like, should we have the arts programs funded by government? They were like, we're not really sure. So what they did was they cut funding. So foundations and other funders may also cut back funding as a consequence of poor stock market performance or changes in the program focus. So many reasons that we can get cutbacks from funders. But again, that may be the first thing that we're handed is the fact that we're getting less money, right? So we have to make budget cuts because of that. Another reason that we actually have to make a budget cut is that there are lower demand for services or the emergence of new providers. So like any organization offering services in a market, and as a nonprofit type organization, you might experience fluctuations or reductions in demand. So if you had a really high clinic response rate for several years, and either you have vaccinated the entire population or something new has emerged that could take part of that market share, it may switch. So if you need to evaluate like over time, before we have to make those cuts, because if we don't have the demand for the services, then we obviously can't keep sustained at the sustained pace that we're doing. The next reason we might have to have budget cuts is in a period of slowing revenue, expense growth must be contained to maintain financial equilibrium. So this cause for cutbacks reflects the organization's failure to respond to changes in revenue and exercise adequate financial discipline, in contrast to the external factors that we just talked about. So if we're bringing in less money or we're not increasing the budget, if our grants are not going to be able to keep up with what the market is as far as inflation goes, this may be some of the stuff that we're talking about. Another reason that we might have to make budget cuts is because of price competition. A nonprofit type organization, like I said, like your local health department, may find that prices for services have gotten out of line. Maybe you're just having to charge too much for the things that you provide, right? And of course, healthcare is a good example of this. Some nonprofit providers have been pushed by lower cost providers to reduce their prices, which means that you would have to undergo serious programs, serious cost reduction in your programs. And then we might actually have unusual cost events. Sometimes a singular event may occur that drive up costs that are independent of your ability to raise more money. A really good political type example is the oil crisis of the 1970s, which resulted in large increases in energy costs for institutions and arguably inflated other costs as well. And such events can force organizations to realign costs and revenues across the board. So you may be in that situation that you have to do so. So there's just some things to think about why we might find ourselves stuck trying to adjust our budget, right? Trying to make these budget cuts, what might be coming at us, and the things that we should be thinking about so that we, if at all possible, can avoid getting to the point where we have to cut budgets. But if we do, can we justify it? Can we understand? Because part of what your responsibility then is to be able to talk to the stakeholders, or if you have people who are working for you, this is gonna come up. It's gonna make anxiety for everybody, you especially as a program manager. So can we look about these things and see if any of these might be coming our way so that we can sort of anticipate what we might need to do, and maybe we can make changes ahead of time so that we don't end up having to cut our budget. Okay. So when we're thinking about this, what are the different types of cuts? Okay, because it's not just here it is, let's throw it in the spreadsheet and it works, right? We have to sort of be thinking about this. And so the first thing is across the board cuts. And in some ways, these are the easiest, right? The primary analytical effort rests in determining the amount to cut. So for government agencies or institutions, the percentage may have been legislatively mandated. And this happens actually a lot at the congressional level. Congress will say, you're getting funded, your funding is being cut by 10% for the next year. So that would be considered an across the board cut for that particular agency. But that doesn't necessarily even mean that it filters down that way when it comes to it. So sometimes the organization needs to determine the percentage for itself. And when an organization makes across the board cuts, the percentage is usually set, and then the managers are asked to develop proposals for achieving the cut in their areas. This still gives, so even when we say across the board cut, doesn't mean that everything gets cut by that percentage, okay? This would still give you flexibility to make cuts where it will do the least amount of damage. So you can cut, so let's say you have to do 25%, right? And here's a good example. I think I mentioned the water restrictions last week, and I used it in a different context about who was getting the benefits and the burdens for that. But in California in 2015, the governor at the time, Governor Brown, implemented a 25% across the board cut for water consumption, okay? Well, this didn't mean that everybody and everywhere had done a 25% cut, okay? What he was saying is the total water consumption for the state of California had to be reduced by 25%. So that in and of itself was an across the board cut. But then the Water Resources Control Board, which was made up of just 5 people, which in a state this large is crazy, what they were tasked to do was to figure out how to come up with, in the end, a 25% cut for the state of California. That did not mean that it was an across the board cut for every person and organization and entity. They actually created a tier system where commercial operations were being forced to cut a percentage of theirs. And even with people, right, if you were put in different tiers, so depending on how much water you used on a daily basis, you were either forced to cut 8%, you were forced to cut 16 or 24 or 32% of your water usage based on how much you were using beforehand. So there was some flexibility in the way they cut, even though it was technically across the board cut. So one of the biggest things for us to take away from this part is, even if you're going to get your budget slashed by a certain percentage, does not mean that you just have to walk right down your budget and say, okay, 10% off of everything. That's not the most useful way to talk about doing that. So if we talk about the percentages, this should still allow you to evaluate the degree of cut that you can keep doing what you're doing, right? Maybe you're actually going to cut something at 15%. That will free you up some money to not have to cut something else. So understanding your budget and where you're actually spending the money, all of the things that we've talked to up until now, can make it so much easier when you're handed this, oh my goodness, I have to cut it 10%, okay? So across the board cuts have surface fairness, right? But they also do not account for differences in the unit's ability to absorb the cuts and their starting level of budget flexibility. The organization may choose to pursue targeted cuts, which is the next one. Targeted cuts can be identified and chosen by the leadership itself or through a participatory process. Leadership may make the cuts by deciding at a senior level where cuts can occur. And so really what we're talking about, even the first time we were looking, maybe we just want to target one thing and that's where the cut is going to come from. This can be used in combination with across the board. If you're handed like a percentage, you can then turn around and be the one that's making the targeted cuts, okay? And sometimes you have to just cut certain things. If you have a participatory process, then the managers and the leadership are working together to sort of identify opportunities to reduce budgets across the board. So it might be that several different programs or departments are coming together to sit down in this process and say, okay, wait, we need to make targeted cuts. We don't just cut everybody. We don't want to do an across the board cut. That's terrible. Some of these programs have to have the money they are having and some of the other ones, right? Of course, that leads to some sort of competition. And the first way to do targeted cuts is to search for excess funding that may have been used in the past, but is not entirely necessary to maintain the programs and services at an acceptable level. The units can also look for places in which they can hold positions vacant, right? You have somebody that you need to replace and you're not doing it right now anyway. Can you continue that for a while to keep your budget on track, at least for this year? It might be that you have to end certain services or close programs or cut back on supporting services. These strong cost-cutting moves are going to bring larger reductions in costs, but come at a higher cost for what you're trying to do, right? And it's going to affect the morale of your organization or your program, your external relations with the community and with stakeholders. So it's really crucial that these decisions be consistent with the core strategy of your program and in the interest of the key clients or your customers or your constituencies, whatever it is that we're really focusing on. And then a participatory approach to targeted cuts might require more cooperation and voluntary sacrifice than managers can handle. In that case, leadership may have to choose a group of staff or may have to hire consultants or something to figure out how to reduce costs, right? For a lot of us, I think that, we're not necessarily used to being in this financial type deal, right? Which is probably why you're here at this point. And so, maybe you are not even well versed in how do we figure out where to cut. So this would be a good opportunity, again, for you to be talking to the finance people and, helping them to help you analyze your situation and be able to maybe target some of those places that we can do, right? This might lead to you of reevaluating your services or reassessing how many departments and managers it should have, taking a look at how many and what kinds of staff we have. Are there new models for things that we can use to replace with technology, right? Is this an area where we've done something in person that we could move it to telehealth that would cost us less in the long run? So sometimes it's a really good opportunity for us to really check ourselves, not only in the money we're spending, but in what is the population we're serving? Has it changed? Are there any of these new options for serving them that we could do something different? So it doesn't necessarily have to be a bad thing. We all think about budget cuts in that way. The last one here, we can think about the technology-driven cuts, and that brings me back to that idea of telehealth, right? Do we have other ways that we can include technology, or are there processes, things that will, this strategy doesn't usually produce savings in the short run because we'll have to get our equipment and get people on board. And so if we're looking at something that we can do long-term to be cutting the budget, right, it's not going to actually be able to help us for this. So it's important to remember, though, that cutting budgets and cutting costs are not the same thing. I'll say that again. Cutting budgets and cutting costs are not the same thing. Cutting the budget gives the organization a plan for lower spending. But achieving this plan requires discipline and specific decisions on hiring and buying that are made throughout the year. So a program with a strong culture of taking budgets seriously and managing to budget will find that reducing budgets results in lower spending by the managers. However, it might be necessary to adopt other policies and procedures to enforce that lower spending consistent with that reduced budget. It might include, as I mentioned before, a freeze on filling vacancies or a review of the processes of what we're doing. Anytime managers are required to achieve budgeted cost reductions, budget performance must be incorporated in a rigorous performance evaluation system that reinforces the need to achieve specified financial goals. Okay, so that's sort of the reason and the reasons for why we have to budget cut. We talked about that. We've talked about these types of budget cuts that we could make. Okay. And then unfortunately, as the program manager, unless you're the person that's doing everything by yourself within your program, you probably have some people that are working in this particular program as well, right? And so when you are forced with this notion of cutting the budget, you also have to communicate those budget cuts to the people who are working within your program. And this might mean to other employees, and this might mean to the clients that you serve, right? To your participants. You're going to have to find a way to be able to talk to that. So in addition to deciding how much to cut and what approach you're going to take, as a leader, you're going to have to determine how to communicate those actions to the rest of everybody that you deal with. Because once people start to hear about budget cuts, they start to worry about their own jobs. They worry about whether their program is going to disappear, and their friends that are within the organization. And then you're going to have a morale issue, right? And people are easily distracted. And so for these reasons, right, as leadership, you might want to keep your budget cutting activity quiet. This might be a good idea, especially if your actions can be discreet and have a minimal impact on others. Like if you're just renegotiating better rates when the contracts come up, if you're looking for a better way to get supplies, like let's say syringes that you can get at a better deal someplace else, if it's something like that in your budget that you can do that's really not going to impact what everybody else is doing. But in most cases, we can't insulate everybody else from the organization, our program, from budget and cost cutting. So we've got to say something about the reasons for taking action and about what will happen. You have to make your own judgment about the amount of information shared and the tone of it, right? It may not be appropriate or useful for you to share everything you know about cost trends, although some information about its specific expectations can be useful. You would need to decide whether to describe the situation in terms of a crisis or if you're going to like soft pedal it, right? As far as public health goes, right, we want to be as transparent as possible. So again, we don't want to scare people. We don't want to be in crisis mode over everything. We don't want to be the one running through the office like we're going out of business type thing, right? But we also don't want to be keeping things from the people who are helping us do our jobs, right? Because we don't want to distract people from doing what they're doing, and we don't want to scare people. And so one way of looking at the decision about tone of communications is to ask whether this is a situation in which everybody needs to drop what they're doing, roll up their sleeves, and start digging out of the mess, or if this is a case where everybody needs to know that, look, we're facing some difficulties, we've got some cuts coming, we're working on it, we're confident that we can respond with, not very much disruption to what we're doing. So please just keep doing what you're doing and be prepared to help out if we ask you. And we're going to keep talking, right? And communicating the budget cuts, remember, rule number one here, assume that everyone is looking for the answer to that one question, will I lose my job, right? This means that everything said by or on behalf of you and the program is going to be scrutinized very closely. They're going to be looking for clues that suggest the extent of the layoffs or that jobs are going to be guaranteed or protected. That means that if a dollar savings target is announced, some people will divide that by what they believe is the average salary to come up with the number of positions they think are going to be eliminated. I mean, obviously their job security is very important to them. So even if there's no intention to cut positions on your part, it may happen, right? On the other hand, an announcement that the organization expects to achieve cost reductions through attrition may be interpreted as a guarantee of no layoffs, okay? So one of the things we have to remember is to keep the messages clear. People can exercise selective hearing during this process. If you try to make an overly nuanced pronouncement on the budget cutting process, that nuance may be missed and people may hear a more discouraging or encouraging message than was intended. If you decide to try to place everyone who wants one in a new job but want to retain the right to offer like a lower salary for a new position, you have to be careful not to say something that is interpreted as a guarantee that nobody's going to lose their job. Okay, because you don't necessarily always know that. Even if you start out with the intention of making sure that's not going to happen, you may be forced to do so. So you want to be careful about exactly what you're saying, okay? And again, I know that you work with the people around you, you work with, you know, the clients and whatnot, but be careful that your stress over cutting the budget, right, is not coming out onto them unduly. Again, we want to be transparent, but we also don't want to make our messages, you know, convoluted, because the next thing is to be careful what you promise. People are going to remember the statements that you make. You should be sure you won't have to lay off people before anyone makes a statement that rules out laying off people or some other painful move. Because once you make that statement, it limits the actions that you can take, or it forces you to forget about the earlier statement you made. And of course, the people in that position around you are going to be really upset about that. And it's really going to impact not only your morale, but your trust. And that can be trust within your program or your organization, but also within your community, within the members of the clients of the programs that you're doing, right? And so we want to make sure that you are not, and it's so easy to do, right? Like, we're not doing it on purpose. We're not doing it to be hateful, but for us to just be like, no, everything's going to be okay. Okay, well, we should be careful about making statements like that, because we don't know that everything's going to be okay till we have an actual plan of how we're going to cut our budgets, okay? So that's one of the things that we really need to think about, is that saying less is better. Again, not trying to be hidden or not transparent, but until you come up with a plan of what's going to happen that you can clearly communicate to everyone and make them understand what's going to happen and why, right? Why are you doing this? Back to, what is the type of budget that we had, right? Why did it get cut? What's going on here? What's the process of how we're going to go? Are we doing these across the board cuts? Are we doing them as targeted? What does this look like? So if you can start to think through those steps, you can more effectively communicate these. And of course, we have to be sure that we know that we're not going to make everybody happy, right? We can't control everybody's interpretation of these events. Budget cutting times are difficult. And after making a good effort to communicate effectively, you have to accept that some people within the program or the organization itself are going to be angry, especially if, let's say, the whole health department has to make cuts. Some programs are going to get cut more than others, potentially, and that's a state of conflict for everybody involved, right? But as a program manager, you're going to have to take that and be able to keep yourself and the rest of the people with you understanding that at the end of the day, we're all on the same page, right? We're all on the same team, and that we have to do these things to make us get to the next stage. And perhaps that's a way for you to go out and look for additional new sources of funding revenue that will keep you from outside of that, right? If we can merge ourselves maybe with a 501c3 or a community foundation, then when we get cut within our own organization, we don't necessarily have to lose our funding streams that are outside of that organization. So just another reason for us to look for what to do. And so a lot of times it's really useful to adopt a formal communications plan, even though it can be painful. If we can, like I said, lay out what it's going to be, it would specify who we want to communicate this with. Do we need to give different information to different people? The timing and the way we're going to communicate that with them. And then some messages need to come directly from the leader. Others can come from just the immediate supervisor. Sometimes we need to have some face-to-face communication. We need formal documentation that people can be like, okay, here's the plan and here's what we're doing, to be able to give those key elements out to do so. Okay, so any questions on why do our budgets get cut? How can we go about cutting budgets? And we're going to talk more specifically about that in just a minute. And again, next time when we look either later today or next week, when we talk about cost analysis and projecting budgets. So how do we get more in the weeds with this actual budget cuts that can be either across the board or targeted cuts? Where do we look at technology? And then finally, we need to be able to communicate what we're doing here with the people who are around us. Okay. All right. Here's what I think we'll do. We're not quite to the part where I would take a break just yet, but it's pretty close to, we were a little bit late taking a break last time. we're getting ready to do an in-class exercise. It's going to take us a few minutes. So I would prefer if we just took a real quick break and get ready to pull this up. Otherwise, I'm afraid I'll lose you by the time we get through this, because we're going to sort of work through this Excel sheet together, and it should take us a few minutes to do so. So let's just take a quick break and go ahead and pull up. I think Emily sent it to you this morning. It would be called the updated adjusting the budget work table. And we'll start there in just a couple minutes. How about that?
Thanks, Trisha. And if anyone didn't receive that, just let me know.
Yeah. Yeah. Okay, and we're back. So a couple of things about this. This is one of those examples that I found on that course. Like I said, it's part of the Region 5 Training Center that's based in Ohio, that's facilitated through the University of Michigan. And the course leader on this was Matthew Stefanik, and he graciously agreed to let me use his example here for our training today. So that's where you get this information. Now, with that being said, that also means that this was something new for me, to be able to use this kind of worksheet that's set up for us to put some formulas in that we can take. And I have gone through it a couple times, but bear with me if I have to stop and think a minute for what we're doing, because again, I did not create this example. So it's one of the, I'm learning along with you as we do this to get more practice. And I will tell you that it does take some practice. So that's why I said, if I am going fast, not fast enough or too fast, let me know, because I have practiced it a couple times this week, just so I would be able to show you at least a little bit how it works. But it did take me a little bit to just sort of think about, like, what am I trying to do here? And what would the formula be for that? And so once we create this, hopefully at the end, again, you'll be able to take this with you, not only for this example, but hopefully then you can set up your own budgets this way. And so this is getting us a little bit to starting to do with how would we go about cutting our budgets? How are we deciding what's going to give us the most bang for the buck? And of course, we can say, well, we know if we just do all of this, we're going to be able to do it. But are there ways to do it that soften the blow a little bit, right? Can we then justify when we communicate with people why we're making the choices that we're making? And this is a little bit like a sensitivity analysis. So what we're going to do is we're going to go through this, and I'll show you what I mean by that. It's not an exact sensitivity analysis. So when we're finished with doing this one, I'll actually bring up just an example quickly of what sensitivity analysis specifically looks like, because we don't want to overstate the terminology that we're using. But we also, this is going to come out pretty much like a sensitivity analysis, but just not specifically, okay? So the first thing is I want to make a couple notes, because I did notice as I was going through here, I tried to change this. His original one had just the same thing all the way across on every different of the questions. And so I think I caught every place that we needed to make a change so we didn't get confused about what we're trying to do here. But if I missed it, I'll hopefully catch it today. And also, if you look at the instructions here, pieces of it, it sort of gives you what you're supposed to do, what we're going to do. But one of the things I noticed is this, it says here like 37.5 hours. And when he actually discussed it, what I had been practicing is 35 hours, I think, instead of 40. So we'll see. Anyway, we can do it either way, but if we do it differently, that's why it is. So this will be a good example, so you can come back and look to see, like, what are we doing? So we're talking about cutting our budget. So we want to look at that original budget tab. And so this original budget, there's a 5% increase. So even though we're cutting budgets, so let's say we're given by the state that we have to increase, because obviously this is salaries, right? This is our personnel part of our budget that we're actually just dealing with right now with personnel costs total. And we want to make sure that we're dealing with not only wages and salary, but the fringe benefits. Fringe benefits in this percentage are at 29%. So here's the current salaries that we have, and here's our total that we're spending just for salaries is $629,780. And I know most of us are not working with budgets that are that large, but it's okay because Excel's going to do the math for us. Okay, so we want to think about this. In this first example, we know that we have to have a 5% increase. So if in your cell D5, right, for the increase, if we just type in 5, you'll see, notice it's already formatted for us to do as a percentage. Okay, so the first part, we want to budget because it's not going to, this particular fiscal year runs July through June, right? That's when they first start. And so our 5% increase in salary is not going to take effect until January 1st, which is halfway through the year. So how do we figure that into our budget, right? So the first thing we want to do is start out with, this is what they make for the year. Okay, this is our current annual salary. We know they're going to get a 5% increase, but it's not going to come until January. So the first thing we have to do is figure out how much are we going to pay them for half of the year, right? So that's relatively simple, right? We're just going to take the annual salary that they do have, and we're going to divide that in half, okay? So let's look at, so we want, of course, with Excel, when we do formulas, we want to start with equals. And again, I'm just going to assume that everybody needs somewhat of a tutorial here. If you already know what you're doing, that's fine. You know, again, I just don't know where everybody's at, so I don't want to leave anybody behind. Okay, so we start, when we make formulas, we use an equal sign every time. And so we just take our current salary, which we can click on in B8, and we want to divide by 2, because that's what we're going to pay them for the first half of the year, half that salary. And then we just hit enter. And now for those of you who recognize that we know that we can go ahead and just click it with the crosshairs here and bring it all the way down. Okay, so that's how much we're going to pay people July through December. Okay, and we're able to use what the Excel is referred to as a relative reference, right? We did the first one and then we drag it down and it'll fill it in. That's what's called a relative reference. And again, for those of you who use Excel, you understand that it works that way. I know that. But sometimes Excel also, and what we're going to need to be able to do here is have to use what they call the absolute reference. And that means that we're going to use just one value over and over and over again. So if you haven't used it in that capacity, then I will make sure to explain why we're doing that and what that is coming from here. Okay, so now we want to say that January 1st, we're getting a 5% increase. Okay, so this is going to come off that current annual salary, right? Their salaries are going to increase by 5%. So in order to do that, we want to say that equal sign, we want to take the current salary multiplied by a 5% increase. But now we want to be able to copy this down here. Okay, so before we do anything else, before we hit enter, we want to let Excel know that we are going to times everything in this column by that D5. Okay, so we want to make that an absolute reference. So in this case, 2 options you have. The first one you want to try is to hit F4. Okay, when you hit F4, if you notice in your formula bar up here, what's going to happen is the $ goes before the D and a $ will go before the 5. It has to go both before the cell letter and number. So if when you hit F4, nothing happens, then you have to go manually enter it. So I'm going to hit F4 and notice it puts my $ in for me. If not, just click up into your formula bar here and put the $ before the D and before the 5. Okay, that's going to identify to Excel that you are using an absolute reference. Once you've done that, anybody need a minute figuring out how to do that? Okay, so we hit enter. And now we are able to go ahead and copy that. Okay, just drag that down. Okay, so now we know how much they're going to get. So for the director that's making $76,000, that's going to be an increase to $3,800. So now that's going to create us a new base salary for all of these people. Okay, so in order to get that, we just say equals what their current salary was. We want to add to it whatever the increase is. Okay. Now we can just go ahead and drag that down. Okay, now one thing I wanted to do before we started is this part where it says % time elapsed current rate. We could, when I did this divided by 2, we actually could do it up here. It would be easier. So what we do is that we set it 50%. Okay, so we could have taken it multiplied by that 50% and use our absolute reference there to do the same. And what's important for that is as we start to manipulate this a little more, the 50% doesn't seem so hard. We can think about it. But as we go through a couple more of these questions, we're going to have to do it by a time value so we can multiply to get that 50% rate. So what's left then, right, in this case is relatively simple. So it would be just equals. And then 1 minus that, right? And of course, that gives us 50. But again, as we start to adjust, we're going to be doing different time periods throughout the year to where we're going to make that cut. So we sort of want to use these cells at the top to help us to do that so we don't mess up with the math. Anytime you can get the Excel sheet to do it for you, right? We want to keep our hands off of that as much as possible. Okay, so now we have the new base rate. So what are we doing for January through June? In this case, right, we can just say, okay, this is going to equal our new base times our 50% rate that we have left, right? Half the year. Again, this needs to be an absolute reference. So either hit the F4 or put your dollar signs in between F5 or the F and the 5, and then hit enter. And then we can drag that down. And then for the last column, we want to figure out the total for the fiscal year. So in order to do this, we need to add what we paid July through December and then January through June, right? So let's hit equals, and then we can just do C8 plus F8. And bring that down. Now let's double check that we have the right formulas here, right? So what we want to do is this. This total is the sum. So go ahead and drag this one over so it will fill this in properly. Okay. So now we have the totals, and notice that this Excel sheet is already set up for us, that it put the wages in here and calculated our fringe benefits. So now we know that this is the case. So if we had this original budget with the current salaries that were there, if we were going to pay them at that rate for half the year, and then we were going to give them a 5% increase, that would make us the new base case. And then what will we pay them for that second half of the year? And what does the total look like then for that person? And how much is that comes down here to the cost of $645,525 and $187,202. Okay. Does anybody have any questions on the first part? Okay. So if we want to click to what he's calling question 1, which is I would call it question 2, but that's fine. If we want to click on this, now it says, okay, let's postpone that raise not to come in January, but we want it to not start until April. And we're going to reduce the increase instead of 5% to 3.5%. Okay. So the first thing we want to do is we have to start with the current annual salary. So the best way to do this so that we can make adjustments to it, because we're going to need to move some numbers, is to go back to the original budget. So we just want to hit equals right here. And if you click on that original budget tab, we can actually bring this current salary here. And notice it says original budget. Notice it's getting it from a different tab. So we just click the enter check mark up here, and it'll take us right back to where we were at and puts it in there. Okay. And then we should be able to drag that down. We can always go back and double check that it did that. Yes, 44, 43, right? It's always good to double check your work. And then we want to go ahead and hit equals sum in here. So we have this formula ready to go. So equals sum, double click. We're going to grab all of this. And then hit enter. Okay, so now we have that formula ready to go. Okay, so now we need to come back up here and use this stuff that we did before. Okay, so the increase, remember, we're not going to have 5% anymore. Now we're only going to have 3.5. So we want to change that to 3.5. And the current time elapsed before, remember, was 50%. Now this is where I said we need to fill this in properly so we know what we're doing. Okay, so this time we want to go July through March, and we're just going to implement the cuts at the end. So here we can type in equals 8 out of 12, right? Instead of 50%, we're going to do 8 months out of 12 for that, and then hit enter. And notice it then calculates for us that that's 67% of the year. Okay. So over here in our new time rating, again, if we take that equals 1 minus and the first part, because this is going to give us the second part, that's going to leave us, of course, with 33%. So now we can use those absolute references to go ahead and fill in our charts. Okay. So the first thing we want to do again is to think about this. July through March, how much are we paying? Right, well, we're going to pay them their current salary, we're going to pay them 67% of that, right? So to get the Excel to do it for us, right, we say equals this salary times this one. But again, we want that to be an absolute reference. So hit F4 or put your dollar signs in. Okay. All right, so now we know what we're paying everybody from July through March. Now we want to give them that pay increase at 3.5%.
Would
Okay.
July through March be 9/12ths? Or is it from the 1st of July to the 1st of March?
Yeah, no, it's a full 8 months. It's like, so it's July, August, September, October, November, December, January, February. It's supposed to be through, it's not April 1st. See, again, this is where I miscounted him. So it's until April 1st. I mean, it's until March 1st is when we started. So we're going with that. But yes, if it was all the way through March, then it would be 9 out of 12.
Thank you.
Sorry. I didn't catch them all. See, I knew I missed it somewhere. Okay. So let's just stay with that. And again, if you want to change this in your sheet to say through there, or we can just go back if it's easier, would everybody just rather we just said it was 9 out of 12? That way we're online when we go back to look at it, we can just make it like that. Let's go ahead and say, let's see what he said on the instructions so that we sort of match as we can. Yeah, see, postponed until April 1st. Okay. So let's go here. Let's just change that. We'll make this equals 9 out of 12. Again, I don't want anybody looking back later thinking, how did we get that number? Okay, so see, that's the beauty of Excel though. Look how easy that was for us to just go in there and make that 9 out of 12, and then it switched all of our numbers for us, even this one. So using those cell references to be able to do that makes it super easy. Okay, so now we have decided that we are going the full 9 out of 12. And so we want to come up with this increase for April 1st at 3.5%. Okay, so again, we want to say equals, we're going to do the current salary times our increase, absolute reference, enter, and we can drag this down. So we want to calculate the new base. So we're going to add the current salary plus the increase. So equals current salary plus the increase. How much is that? We'll go ahead and drag it down. Okay, so now we have established what the new base pay is going to be. And in this case, we're just going to do it April through June. So we can equals that new base multiplied by our new rate, absolute reference. And then to get the total for the fiscal year, again, we're going to add what we paid July through March to what we paid April through June. So equals July through March plus April through June. And now we want to take this formula here and make sure that we have gone across the board. So it fills it in nicely for us. Okay, so we can see that our wages and salaries are 635 and our fringe benefits still 29% or 184. Okay, and we're going to be able to sort of compare these two at the end when we get to the summary. I'll show you about that.
Excuse me, when you drag your bar across there to make the totals, do you have to push enter after you drag it over, or does it just do it?
So it should just do it as long as you grab it in the crosshairs. So here's what I teach methods. So for my students, normally what I say is this. So see how my the cross is there right now looks sort of like an ambulance cross.
Yeah.
Right. Okay. So when we're doing something, we want to drag a formula. We want it to look more like a crosshair, like that. So if you just grab it like this and go across, right, it should do it automatically. Should just go like when you do it and let go.
And just let go and it adds it. You don't have to put enter.
Correct.
Okay, thank you.
You're welcome. Anybody else have any other questions before we go to the next one? See how fun this is? Think about how much you're gonna be able to use all this stuff. And just you get to just change these little numbers up and it like flips it all for you, right? So you don't have to be a financial wizard to do it. We just have to have some good tools. So I'm excited about this. Now, this is just when we said, okay, we had a pay raise coming, right? But how do we implement that and what does it look like, right? So now we want to actually start talking about some of the hard stuff. So if we click on the question 2 tab, question 2 tab says, we want to reduce all hourly staff from a 40-hour week to a 35. And this is where this doesn't match what he said. But again, as I practiced it myself, I was doing 35. So we're going to stick with 35. Okay. So that I don't think my numbers don't line up. But you could easily do it at 37.5 because we're just going to divide by. So you can put that in either way. But on this sheet, it says 35. So you might want to either make yourself a note on the instructions, go in there and change that to where it's 35 so it matches, or just, you know, type yourself a note here that we use 35 instead of 37.5. Okay, so we want to start off with that current salary again, and it's always best to go back to get the original reference to that so that we understand where our money's coming from. So we want to say equals back to the original budget, this one. And it jumps back over for us and we can copy that down. And then let's go ahead and hit our totals cell. We want to hit equals sum again. Okay, so now we've established this is where we started from the before. And this time we're going to reduce all hourly staff from 40 hours a week to 35 hours a week, okay? And we're still gonna have our increase. Okay, we still have this pay increase that we have to deal with. So in this particular scenario, we're still gonna have a 5% increase, okay? And we're gonna go July through December. So that's, right, we can do this. Hold on, let's do it like this. Equals 6 divided by 12. Oops, that didn't work. Didn't like me better, did it? There we go, 50%. And our new time remaining is still going to be equals to 1 minus that, right? But now we have to figure out this thing that we've sort of ignored all the way through here. Now we have to figure out our base hourly reduction. So what we're doing is we're going to do what? Only 35 out of 40 hours. Okay, so equals 35 divided by 40. So we're going to be paying them 87.5% of the salary, right? Of the current salary. Okay. So to adjust this, we actually want to adjust the salary to begin with. So we're going to start in this first column before we do any other adjustments. So we click on here, it's the original budget, right? The original budget. So we can just jump into the formula bar up here. We want to times that by this reduction, because we're only going to pay 87%. So we want to click that cell, but then again, we want to make it an absolute reference because we're going to drag it down throughout. And then we can just hit the check mark and then go ahead and drag this all the way down. Okay. So now we have set the base case to be working 35 out of 40 hours. So here's what would happen. So again, justifying, here's what happens if I cut everybody's hours by 5. Okay. And actually, that's wrong. Because what we didn't want to cut, we were supposed to be reducing all hourly staff, right? And so these first 3, the director, the fiscal manager, and the program manager, we would actually leave alone, right? We wouldn't start with theirs to be different because they are on salary, right? They're not hourly staff. So you could undo that if you want to. That would be great. And we can just click back up here into the formula bar and go backwards. See, I told you I would make a mistake at some point. Okay, so we'll just leave that original. And now we can go ahead and we'll just double check that everybody's the same, scroll it down, it shouldn't change. We should be fine. Okay, so how do we do that? We say, okay, we're not going to deal with these 3. They're going to stay the same. So we actually want to start with the medical records coder number 1. Okay. Then we're going to go up here and times it by our 87.5% and use an absolute reference. Okay. So then we can come to them and drag it down the rest of the way. Let me double check that we have changed this because I went too far. There we go. Okay. Did I totally lose you with making a mistake there? Are we okay? Okay. So again, we're doing that, and that's the beauty of using this program, and thankfully I caught it. We can catch yourself, and you can go back and forth, right? You can click on the cells and see what you did, and if you've made a mistake somewhere, it's so much easier than having to do things on paper. But we are not including these 3 because they're on salary. And we will have, I mean, there's going to be instances where you do have people that are salaried and that reduction of hours is not going to matter to them. So you wouldn't want to take that into account when you're doing that. So we left them alone. We started actually here with the records coder and what we're doing for that. So now we've managed to reduce the hourly staff hours from 40 to 35. We've left our 3 salaried positions alone. And now we want to just do what we did before. And we want to look at July through December rate of pay. So it's going to be equal to our current salary times that rate for the first half, which is 50% in this case, make it an absolute reference. Drag it down. We also want to establish a 5% increase, but remember now we're working on that 5% increase from the reduced hourlies for most of the employees that we have here, right? So again, everybody's going to get an increase, even the salaried people. So we want to say equals. We're going to take our current salary, multiply it by our 5% increase, make it an absolute reference. Now we know how much each pay is going to increase by. And so our new base is just equal to what we started with plus our increase. And now what are we going to pay them from January through June? That's going to be equal to our new base case multiplied by the time left we have throughout the year. We want to make sure we F for that. And then our total, of course, is just what we paid them from July through December to January through June. We want to make sure that this goes across. And now it's calculated this for us. Okay.
I have a quick question, Trisha. So I see that you use that increase of the 0.05. Could you have multiplied it by 1.05 in order to just skip some of those steps? Would that have worked?
Okay, so where are you asking me?
Right. So instead of multiplying, so you took that and you multiplied that 38,000 by that 5%, right? Or no, that was
the current salary. So the 76 times the 5% increase.
Right. Could you have just multiplied it by the 76,000 by 1.05 to straight get the answer to the new base, so you didn't have to do that extra step for addition?
Yes, but part of the reason that we want to do it like this, and again, this is his setup, I'm just sticking with it, is because this piece allows us to change this 5%.
Okay.
Because like last time we did the 3.5 and then the math gets complicated. Like for a 5% increase, it's fine, it's 1.05, but it just shows you where the numbers are so that if you want to show someone else, you can say, okay, look, a 5% increase is actually going to be this much money for this person. If you just go straight to here, then people have to do the math.
Okay.
But yes, you absolutely could have done that and just skipped this piece of it and went straight to here. But if you're going to start to show people, okay, here's what a 5% increase looks like for everybody, and here's what a 3% increase looks like for everybody, rather than having to have people subtract this, because when the numbers get high, 79,800, you're subtracting 76,000. Okay, wait, that's $3,800. So it's just, he put in multiple steps so you can very easily see what you do, but that's absolutely correct. You could go straight to the new base.
Okay, thank you.
Okay, so now we figure out how to do this. So here's where it gets fun. Okay, this is where we really have to stop and think. But again, I think it's a useful tool because you can see that you can sort of, I mean, like we can do different things. And this is exactly what I was talking about, how adjusting the budget isn't just like, oh, we're just doing this one thing. Maybe we could do it this way, or maybe we could do it this way. What is the most bang for our buck, or doesn't hurt people the most, right? How can you justify the cuts you're making in that potential to get where you need to go to hit that bottom dollar? Let's say you've been given an actual, I got to decrease from here to here, but how you do it might be up to you. And so that's why I think this is a really useful exercise, because you may have different metrics, marks of what you're putting in here as far as like wage. Maybe you only need to do reduce the hours to 38 instead of 40, right? And especially if it keeps them still at their full time where they get all their fringe benefits to do so, and it saves you enough that you met your budget cut, you probably won't have as big of a morale problem as if you say you're not getting your pay increase later, right? So that's just sort of these are the tools that you can use to help you decide which way you're going when you get there. Okay, so question 3, again, this is where it gets fun. What happens if you did both, right? So now we get to use all of our tools. So we want to start with this one. Like I said, this is where it gets fun. So back to equals. And we want to take that original budget. Here we go. And we want to drag that down. And then add up our equal sum. Okay, so now we know what we started with. Okay, let's go up here and fill this in. We're going to go here to equals 35 divided by 40. We're going to go July through March. So remember, we changed this to say equals 9 out of 12. We're going to do just a 3.5% increase instead of 5. And so our time remaining is equal to 1 minus our current time. So now we filled in all our cells, right? We know where we can use our absolute references from. Now, remember, the first thing we want to do is get this hourly reduction of wages, but we don't want to include the director, the fiscal manager, or the program coordinator. So we want to just go ahead and click here on this original budget. I mean, on the B11 that gives us back to that. And then up here in the formula bar, multiply that by our reduction. And now we can drag that down so it does it for everybody. It didn't like that. Oh, why? Because I didn't make it an absolute reference. It tried to do it as a relative, right? Okay, so we want to B5 absolute reference. There we go. See, Excel will tell you when you do it wrong. Okay, so now we have left our 3 without changing them. We have reduced the hours from 40 to 35. And now we want to say July through March. What are we paying, right? It's equals to the annual salary multiplied by the current time rate, which is going to be all the way through March. We want to hit that F4. Drag it down. And now our budget increase, again, is going to be 3.5%. So in this case, we're going to equals our base case multiplied by that 3.5% absolute reference. So our new base case is our annual salary plus the increase. And then what are we going to be paying people April through June is equal to the new base case multiplied by our new rate, F4. And the total for the year, of course, is just what we're paying people from July through March and April through June. And at the bottom, we want to drag this across. And there we go. So here's our totals if we implement both. And now if we click on, is everybody okay there?
Yep.
Okay. If we go to summary, it's already, this is why I like this thing, because you can literally just type in all your own stuff, delete out what he has in there already, and then he has it already set to where it brings them all in at the end. So this is a nice feature. So we can look at, here's what our original budget was going to be. Here's what we did if we did cost cutting option number 1, option number 2, and option number 3. And here's how much we're saving. So obviously, if we do both, we're saving the most amount of money, right? If we cut, we don't give them a wage increase until April, and we cut the hours from 35 to 40. But by adjusting the different kind of things, we get to see the option. And depending on if we just have to slash budgets, okay, we're getting to here. But maybe it was a matter of fact that we just had to hit like a little over $10,000 as far as cuts go. What if that was the 10% they gave us was, you know, that $10,000? Well, that first option would work, and that would be enough. It's just to say, okay, wait, we're not going to do it until this point. Okay, so this is a good way to look at the differences that you have once you put in the different values, and you can set up the sheet to just give it to you at the end. And as I mentioned at the beginning, this is sort of what I call that sensitivity analysis. Now, a true sensitivity analysis looks at the higher and the lower ends of what's coming. So this wouldn't necessarily be an actual sensitivity analysis, but notice it's giving us different options and different outcomes. So where do we really need to be? Which one of these things might be the most useful? You can put in all kinds of things to change that, as far as, like I said, hours worked, how many people you actually have on staff, all of those different kind of things can be thrown into this analysis. But this looks a lot like a sensitivity analysis. And so if we're good on the questions on this, what I will do then is bring up that sensitivity analysis, I hope. And you'd have this, a copy of this also. It's called the sensitivity PowerPoint example. It's because it was taken from a PowerPoint, but it's on a Word document. So we'll just look at this, what an actual, so this is another useful tool, sensitivity analysis. And I originally had it scheduled to talk about when I talk about scenario analysis next week, but since this particular workbook sort of lent itself to it being a lot like this, I thought we would do it today. So we will talk about scenario analysis next week versus sensitivity analysis, which actually deals with the numbers, okay? So this is a technique that assesses how changes in a single input variable affect profitability. And when an estimate of this sort is like included as a baseline of judgment, you can sort of estimate the range of uncertainty through sensitivity analysis. So to do a true sensitivity analysis, the first estimate should be based on the value and the values that are judged to be correct. So what you think, like based on your budget or your plan or your program, then you're going to want to make 2 more estimates, okay? So these are supposed to be 2 extreme realistic estimates that reflect possible scenarios. So if you only include 1 variable, then the analyst estimates the value that variable will have, then makes 2 more estimates using the highest and lowest possible values of the variable. If you have 2 or more variables, all combinations have to be calculated, and then the reported values should be the expected value and the highest and lowest. So that sounds super complicated as far as like explanation of what it is go, but it's kind of easy if we just look at this example. We can just look at one thing at a time. Okay. So in the first one, we have the senior center. And we're looking at serving them meals and how many, what would be the differences if we were changing the number of people enrolled. So that's our first, we're going to use the first one as though it's just, we're changing the number of people that are enrolled in the program. So here's a way we can do that. If the first column there is what we actually estimated. So that's like our plan. That's like our budget plan, our operating plan, whatever it is that we see, here's how much we're going to do these things, okay? This includes all the stuff. So we think there's 4,000 people coming. We have 7 meals a week. There are 52.14 weeks. And the yearly meals cost then is this almost $1.5 million. And the cost per meal is $6. So here's our total cost for our program. And here's what's going to cost. Now, the variable that we're dealing with the sensitivity analysis is this estimate of 4,000. So what would be a reasonable, really low estimate for that versus a really high estimate for that, right? So in this case, the low estimate is the 3,000. So we can see how that impacts our costs, come down considerably. Or the high estimate, if we ended up with 5,000 people enrolled, based on what we think we're going to do, it would exceed the cost by, $2 million, over $2 million. So we can do that just by plugging in what would be a high and a low estimate. And that's an example of sensitivity analysis where you say, okay, here's the marker. You can go further and do it. You can do it to all of the variables that you want to look at within your program. But one of the ways that you can do this is actually by looking at this senior center with the two variables. So if we're talking about enrollees plus the cost of the meal, right? In this case, we started with, this is our mid-level, this is what we expected to see. And our number of enrollees were $4,000. We also saw that our cost of the meal was at $5, okay? Which is interesting. It actually should not say $5. Oh no, it does. I'm sorry, it does it separately. I was like, wait, it shouldn't say that. Okay, so the cost for our low end, right? Because remember our original cost was $6. So if we're using this and we want to take the cost of the meal across the bottom here, and that's $5, okay? So that's our low cost. And here's where we change at the top, then the other variable like we did before, 4,000, 3,000, 5,000, okay? And then that gives us our total cost. Then we can do it if we want to make the meals per week, the other dollar on the other side, which would be $7, right? And so that leaves it there. And then also we change the number of enrollees from here. So now we have all of this information that we can look to see the total cost of the program and to see what we actually would need to do, to make these things happen. And why we are getting, to that point. So depending on what you're trying to do here, are you trying to provide more services? Do we need to find a way that we can enroll more people, but make the cost of the meal less? How much is that going to change where we're at? Noticing what we're doing after we start to do a couple of these things, we can look to see that, we can spend more money on that same amount of people, like on that 3,000 people, and hit, a little bit higher of a cost here. Or if we can hit that target at 4,000 and we can lower that cost, then look how much that comes down, right, to just the 7 million, a little over 7, it's like $7.2 million. So this is just a really useful technique into thinking to yourself. And so that's helpful as we get into budget projections, when we're going to talk about that a little bit next week, is that we want to start to think about, okay, what kind of changes can we make? Notice that almost everything we're doing here is sort of an adjustment. It's what if we did this? What if we did this? And that's really, as the manager of the financial situations and of the personnel and the people, you have to think about all the different costs that you have, the different revenues that you have coming in, and what would happen if you did this. And that sort of makes you crazy, right? Because you can get into the weeds very quickly with, well, what if it was this? What if it was this? But these kind of tools sort of help us stay grounded a little bit and say, okay, wait, what do I actually want to look at here? Do I need to look at every single thing that's in the program? Do I need to give, like in the example that we just did, is it okay enough just to look at what the salaries are? Do we have to cut hours? Do we have to cut pay? Do I have to cut people? And you can use some of these tools to then evaluate like what you're thinking about and what is your end goal, right? Like you always want to start at the end and do some backward mapping. We want to kind of look at that and think, okay, if we had some time here to do the kind of things that we're doing, what would be the most important thing, right? Is it more important, like in this scenario, to feed more people and it would be okay to get something that costs less? Do we need to try to stay at that $6 per meal? Can we afford to go to 7? Is there ways for us to get some in-kind contributions that would help us to bring the cost down? Are we even going to hit that target, right? Do we have enough people in our community? Is 4,000 too many? Are we going to be higher than the 5,000? right? Right now, that's our high estimate, but that goes back to the idea of documentation. What do we already know? What are the services that we've been providing, right? And where do we look to go in the future? Because anytime that we're going to add more money, right, or more services, or if we're going to have to be in a situation where we have to cut budgets or services, we just want to make sure that we are covering all of the things, right? And so it can be overwhelming, but it's just like with anything good. It's sort of like when you start a do-it-yourself project at home, right? You know what the end game is supposed to be. That's true. But, you know, we're not the HGTV superheroes. We can't just start busting things down and hope it all works out. We have to have a plan, right? And our plan really starts with the budget. And we can say, okay, here's what we know from before. We can think about the different ways we could possibly budget. We could do incremental budget. We could do the zero-based budget. We could do activity-based or value-based. How are we going to come up with what is the plan? Because remember, the budget is just the plan, right? And it's never going to be perfect. We have to stick to what we have as far as money goes, but we know that there's going to be some change, and we can use things like variance analysis to keep ourselves on track. We can use tools like sensitivity analysis to say, okay, what are these different things that have happened? If we change these dollar amounts, or if we change these number amounts, this could even be like how many people we served at the flu clinic, right? If we made changes to those kind of things, what would that look like in terms of our budget, right? So we have to take that information, and if we're documenting along the way how many things we have here, we can hopefully know where we're going to go in the future. And if we can do that, then if we have to come along and make adjustments to the budget, either by increasing, and notice that why that workbook we just did was not actually called budget cuts, because technically he was adjusting both in cuts and in increases, right? He was just actually adjusting the budget. And sometimes you have the capacity to push things off, and sometimes you don't, right? You know, maybe we would have been stuck with that 50% increase in January, and we would have had no option but to cut hours down to 35 or 37.5 or whatever would work to do so. But you also have that threshold of thinking, okay, at what point does that interfere with employees' permanent work time, right? If they're all working 40 hours a week, obviously it's a pay cut, but can they sustain it? Is it going to be okay if they get to keep all of their benefits, right? So when we're thinking about how much to cut, is it better? And again, that would be another scenario that we could put back in there, in that we looked at potentially, what if we eliminated one position and kept everybody else at 40 hours? Is that the best thing to do? And you could run that as well. What would be the outcome for doing that, or getting rid of 2 people, or making 2 people that are full-time, part-time? So there's so many options for what you can do. You just have to stop and think about, okay, what is the program goal? What am I beholden to by my grant? What do I have to do in this grant cycle? But you also need to be forward thinking, because it's going to be time to renew that grant, right? And when we do that, you want to be able to realistically ask for the appropriate things and for the right budgeting. And you want to be able to put in your budget when you turn it in to say, okay, here, I know these things are coming. What am I doing to solve this problem so that I don't have a budget problem when I get to the end of this, right? And so again, the best thing we can do is just to stop and come up with, where are we? Where are we going, right? What are the possibilities that could happen? And just take it slowly. Don't overwhelm yourself with trying to come up with all the answers. Again, today in the workbook we did, he had already laid that all out for us. So we didn't have to stop and think about, well, what about this or what about this? When you start to think about these changes, it makes you a little crazy, I'm certain, right? Because nobody wants to do any of these things. It would be nice if everybody just handed us our money to do our programs and then we were good. But that's not the way this works in the real world. So I would suggest to do one thing at a time, either by using a tool like the sensitivity analysis, where you can change one variable even and see what happens, or to go back in like with the work that we had and decide, okay, do I want to look at something like cutting salaries? We used it as an increase. I guess I should have mentioned that. I'm certain you guys all understand. Here we go. In this case, we have the increase, right? We could have said we have to cut people's salaries by 5%. In that case, we could have just made this a negative. right? And then it would have subtracted it for us. So this, we used it as increasing with these other ways to cut the budget, but we could actually just as easily have been where this was a decrease. So once you set the tool up like this, if you can just delete out all this information. That's what I did for all of you today. And then we put the formulas back in. So if you want to, save a copy of something and then create your own, as it's moving, then these pieces will all actually stay put in here because he had created those to begin with. But you can do decreases just as much as you can do increases when it comes to that kind of a thing. And the same goes for the sensitivity analysis that we just looked at just a minute ago. Okay, so does anybody have any questions on what we've been talking about?
I
Okay.
really don't. I know it's going to be a lot easier to understand this once we actually have a grant.
Right.
Now, it's a little confusing, or it's a lot of information if you don't have something to apply it to.
Right, right. And that's hopefully, like I said, that's one of the biggest reasons that I put the handouts in, right? Is so that you can go back to the resources later and you'll have the PowerPoint. And I know that the training itself is recorded, so there's some options, and then you can fast forward and just use the stuff that's really useful.
Yeah.
And it is a lot of information. But hopefully it's useful.
Yeah.
Hopefully everybody's having fun in that little Excel sheet. I was super excited because that's really hard to set up. So again, all of us use Excel, but it's like any good computer program. You basically use it for the thing that you use it for, and you don't use it for anything else. So you're not really well versed in like, oh, I didn't know I could make it do that. Or, oh, what is that? And so I thought it was great because part of what I find is the most difficult is trying to create the thing to begin with. It's not hard to use it. It's hard to say, wait, how would I make it do this? Like, what's that formula look like? I mean, what are we going to have to do when it gets to that? And so I just thought that was really cool that he had already put in, I mean, I had to figure it out. Like, what is he doing with this? And when I was doing it, I thought, oh, well, that is convenient that it's set up to be like, just change that to 87%. Okay, that's great. Because that's the kind of things we don't want to think about, like when he said decrease it from there, my first thought was, wait, well, how do we do that? Well, it was 9 divided by 12. That's it. And there it was, right? So I just think that's great that when these things exist in the real world, about the absolute value, but oh, cool. That's great. I love that. Yeah. You've been typing $signs, F4 baby all the time. I got my son this week on that one too. So, he's a freshman in college. And so, he knows everything more than mom now. Right. But he has to take, he's a finance major. So he has to take the basic business admin. It's called 212. It's pretty much Word, Microsoft and PowerPoint, right? And Excel. But I said something about, well, I guess he said he was a master at Excel, and I laughed because, all of us work with Excel, but like I said, we only use what we use. And so he was, I said, well, the difference between absolute and relative reference. He's like, oh yeah, the absolute. And he said just the same thing you guys said, the $signs. I said, you don't just hit F4. And he was like, what? And I was like, see, mom knows some things. But it was just funny because we don't, and I actually learned that on accident looking for something else because I teach this statistics course, and we use a computer program called SPSS on a regular basis, but a lot of the things we do, they can do in Excel, and people don't realize you can. So I always try to show them, because once they get out of college, they don't have access to that SPSS anymore. And so anything I can teach them how to do in Excel, and that absolute references. So we do workbooks all the time where we fill in stuff, and you have to. Now I do find this, for those of you who have Mac, you probably don't have the F4. So if you're at home doing it, it's probably not going to work for you. You have to use $signs. But anyway, that's just a little side note on that. Okay, so all right, let's take a break because we're going to get into some cost analysis, and that's going to be another spreadsheet after we talk a few minutes. So we're right about that time frame for a break. So let's take this last break and get ready to finish up this information, and we'll be all good.
Thanks, Trisha.
Okay, so let's do this last segment for today. And we'll talk a little bit about what we're going to do next week and what that kind of looks like. So cost analysis. This actually brings us into some of these financial management type tools. And this one, this information and part of what we're going to learn next week comes from the second course. And this one was actually taught by Noah Stubbe. And again, I was in contact with him and asked for permission to use this information for this training. So thank you to both him and Matthew Stefanik for granting me access to some of these materials so that we could talk about this kind of thing. Because again, cost analysis is not necessarily something that we really think about. So we want to just kind of look at why knowing cost is important. Why is it important for us to know the cost of providing services, right? So the ultimate goal of managing costs is that a minimum to break even or not to run a deficit, right? So at the very, what we call that break even analysis type thing of where we are bringing in enough revenues for our program and not expending more than what we're bringing in. So many public health services depend on user fees or reimbursements from other sources like Medicare or Medicaid in order to continue operations. So accurate cost accounting is really just absolutely necessary to assure that as much of the cost of providing these services is recovered by your organization as possible, right? So often these sources of revenue are insufficient to recover the entire cost of the services. Right. So in this case, it's important to know if and how much your organization is subsidizing the services with revenue from other sources. So for some of you, you may have a grant that covers, 80% of your program costs, and then you're being subsidized either by the health department itself, from other programs, from other grants, from outside sources. So you really just need to, get a good handle on. We first talked about at the very beginning of last week that the difference between the total project budget, program budget versus the grant budget, and they're not the same, right? So making this assumption that what you get from the grant is going to cover all of the things, we have to sort of take a step back. And so doing things like cost analysis can help us to see how much our sources of revenue are coming. And so once we finish discussing a little bit about why we do this and why we don't do them, and what that kind of looks like in the process, then we have an example that you guys are going to get to work on a little bit on your own and start to see how we can kind of do that with what we're working for. So we need to know why costs are important. Like that's a big thing for us in general. And there we go. So why aren't they usually done? Okay, so in the public health realm, there's a few things of why we don't do this. In government and public health, the non-for-profit sectors, here's part of the thing. I mean, how many of us have heard this or thought this ourselves? Well, I don't do all this cost stuff because that's not why I got into public health, right? This is not the kind of thing that we need. We're not trained for this. We didn't go to school for these things, right? We just sort of think the financial people will take care of all that. But we really can't do that if we want to be really efficient and effective and equitable managers of our grants and our programs. We really need to be a little bit more hands-on. And so that's going to have, we can use some of these tools to help us get to that second piece of it. And I'm certain that maybe at this point, some of you have felt like this seems a lot like a business class, right? Like a lot of these things we're talking about, financial management, accounting, and those kind of things, right? And so that seems like it takes us away from the goal of public health. But the truth is, we have a limited number of resources, right? Especially when it comes to funding. And so if we want to be able to keep the programs and be sustainable over time, or to help to grow those for our communities, we do have to sort of take that business mentality approach of this. We do have to look at effective ways to cut costs and to know what they are and to identify them and to either find additional sources of funding or to potentially increase our sources of revenue, because for some of you, you do have programs that bring in some revenue. And so can you increase that revenue and also at the same time decrease your costs, or at least find additional sources of funding to help to offset those costs? So it's a balancing act, right? And we're used to that. I know, again, a lot of you are working in smaller health departments and whatnot, and you're wearing many hats and you're funded by many different sources and you're trying to piece them all together. So I don't think this is a new type of information, but so how do we sort of look at that? And we've looked a lot as though we have just an expense budget, right? We haven't really dealt a whole lot with revenue. And so I've added this part into the course purposely because I do know that some of you are dealing with revenue streams. And so we want to kind of look at both cost cutting prevention and also at potentially increasing revenue streams, or what is the balance between if we have X amount of dollars coming in as far as a source of revenue, what can we afford to spend to get to that point? What would we need to charge for our services, right? Because whatever we're setting our service fees at is going to obviously amount to the amount of revenue we have, and that puts us back to where the spending is. Okay. All right, and so sometimes we just don't have experience working with cost analysis, so it just keeps us from doing them. Plus, none of us wants to charge people for needed services. The last thing we want to think about is charging people within the community that we're trying to help, because we have to be able to generate some sort of revenue to get to where we want to go. Okay. So it's essential in order to deliver public health services in today's environment. It's very important to understand the costs so that we can continue to deliver the services. A budget can quickly turn upside down if you don't understand what's driving the costs. And it's sometimes said, no margin, no mission, right? So if we have no margin, that is, if we're not taking in at least a little more money than we spend, then we're not going to be able to fulfill our mission for that kind of things, okay? So cost analysis that follow a set methodology really help us ensure that costs are being accounted for consistently across all of the programs. Either just if you're just a program manager, you can use cost analysis, for your program itself. If you're in a higher up position, if you're overseeing a department or a division or the health department as a whole, this can help you. Using this kind of methodology consistently helps you manage your programs across the board. Because again, some of you are managing just a program, some of you are managing just a grant, for a particular piece of a program. And I know some of you are at higher levels than that as well. So knowing your costs now allows you to be nimble in your response to requests for services from prospective funders, such as grant making organizations or agencies or businesses willing to pay for services that you're really able to provide for them. And so if you have this kind of cost analysis and these tools, then it makes it easier for you to be able to do these kind of things in the long run, right? So you want to have some sort of consistency. And if somebody asks you, they're interested in, right? Like, what if you were using those tools that we talked about last week and you're reaching out to people and you're able to say, okay, so here's the deal. Here's what we're trying to provide for the community, right? We want to provide this particular service, and maybe you already have it started, or maybe you want to expand it, or there's a greater need for it, or you want to, add another clinic or go, do something that's like a fair inside the community. But you need to know what the costs are associated with all of those kind of things, not just to mention the program you've got going now, right? And so a way to look at that, and then when we can show people how much it's going to cost, which nobody likes to talk about how much things cost, but if we also can then say, okay, but then if we can do this, we can identify sources of revenue that will help us to offset those costs, and that will give us the capability to engage more within our community. And using things like participatory budgeting, where you can get out and talk to the people that are within your community, will help you actually to engage with them, in greater ways. And so this is why we want to be able to do this kind of cost analysis. Okay, so I'm going to leave you to your own devices here in just a minute. You have what Emily should have just sent today. It should be called the copy of the updated cost analysis. And so this is the very last piece of it. So if we go into the instructions, there's a couple things I want to make sure that they didn't change for you. So what this basically is here is the scenario, right? Each year, your health services organization is asked to provide seasonal influenza vaccination to an employer's 3 factory sites in your community with walk-in clinics staffed by your employees. You need to know what you should charge to ensure you recover the costs to provide them. Okay, so you guys are willing to do it. It's great. You're working with them. This is awesome. You've got some community outreach going on. You know how much you pay your nursing staff and support staff on an annual basis. Okay, so you're going to have to pull some people to go do this clinic. So here's the key. You have to figure out how much that actually costs. We can't just be like, oh, it's just the cost of, what we need to give the vaccines for the day. No, you want to take into account all the costs because it's coming out of your program or out of your health department or whatever that particular organization is, that you have to take into account their salaries, payroll related expenses, travel, training times, supplies, indirect costs. Okay. So what this has done here is to set up, and again, I want to double check that's here before I leave you off on your own. I added a few things here because he didn't have the information on here. So on the salaries page, which is the next tab, you're going to input the number of positions you estimate you will need per clinic, the salary, and the number of hours the clinic will operate, the percentage of time that it would take the person to work, and then this will give you the total hours of the program. So I added this information so you know what you're going to need. You're going to need 2 nurses. They each make $50,000 a year, and a clerical staff person who makes $35,000. The clinic is going to be for 3 days. So you're going to have to calculate the FTE for each worker. So the hint for that is there are 260 work days in a year. So you take 3 divided by that, that will give you the percent FTE. Okay. So, and I'm going to walk through and not do it. I'm going to let you work on it for a couple minutes after we're done, and then we'll go through it together. So I went ahead and put in the salaries. So, because we're going to need, I said 2 nurses at 50,000 and then the clerical at 30. Okay. So using what I told you before about the 3 divided by 260, equals your percent of time to the program. So that's going to give you that to put in here. And once you fill in that percentage of time to the program, it'll fill in for you. Okay. And that'll give you that salary. So once we get the salaries piece done, then the next piece is to go on and figure out Social Security, Medicare tax, and workers' compensation. And this automatically generates these things. So in this case, 6.2 is Social Security, and 1.45 was for Medicare, and 3 for workers' compensation. And health insurance is based upon the total of percentages of staff time allocated to the program from the first section. So salaries have to be multiplied by the annual cost of insurance per person. So if we click on the payroll here, I've put in a couple other notes here. So if you click back to this instructions, in this particular field, he has combined Social Security and Medicare. So you'll need to take that. It's going to be this percentage. So we have Social Security was 6.2. You're going to have to add in the Medicare, add those 2 percentages together, and then take that as a percent of their salary. Okay. And then we don't have a retirement expense in this thing, but we do have the health insurance premium. And here's a note about that. The 3 staff, their premium cost to the agency is $18,000 per year per employee. So those are the premium costs that can be allocated to the program. It has to be that percentage. So whatever your FTE is, you're going to want to take a percentage of that for the $18,000. And then traveling, it's 24 miles to the clinic round trip. You're going to multiply that by 3 clinics by 3 people, and your reimbursement rate is 57.5 cents per mile. So that will go into this box. And then as far as the supplies go, your doses are $18.98 times 1,000 doses. So you'll have to make a formula for that. And then on the instructions page, it actually tells you exactly how much this is. $45 for the bandages, for the so the vaccines themselves are, here's the cost of this. Syringes and needles are $7.50. The sharps container is $45, and the bandages, alcohol pads are $51. And then we have an indirect cost that is 30%. So the very last piece that we have here is where the indirects go. So in this example, again, very gratefully, he has included stuff to where if you had other things that you were going to do, other costs that you had to have, that's already set up for you. But in the scenario that he's included here, he doesn't include us having to do any of that, because in this particular case, right, we're going off-site. So they are donating the space. So we're not paying for utilities, telephone, water. If we were doing it on site, we would have to take into that indirect kind of occupancy kind of cost. But that is basically an in-kind contribution to our program that they, because we're going on site to do it. Okay, so here's the indirect cost, and I said, it says in there that it's 30%, and here is the direct cost of the program. So you take 30% of that to have here, and it should fill that in. And then once we get here, we don't have any other miscellaneous or equipment. This one, I think he said here, equipment depreciation is included. So you would have to know that. Does your indirect cost rate from your organization, do they include equipment depreciation, or do you have to do that separately? And in this case, we don't have any, but if you were using this as a tool in the future, that would be the same thing. And depreciation, again, if we had objects to do that. And then we'll get to the summary sheet and the budget computation. So I'm going to let you fend for yourselves for just a few minutes and see if you can walk through putting these pieces in that and where we go from there. And then I will go through it with you so we can make sure everybody's on the same page. Okay, let's go ahead and look at this and see. You guys can just follow along, and if you got it done, great. And if you got stuck someplace, hopefully we can figure out how come. So let's go ahead and look. Again, the salaries, if we did, we already had inputted in here 50,000 each for both nurses, and there's 30,000. I think you guys have 35, so that's going to make our numbers off just a little bit, I do believe. We have 35, is that what it said here? I love how these don't all match up. Oh, it's on the one I put in there. Did I give you guys 30 or 35?
We had 30.
Perfect, thank you. Just making sure. All right. So when you're figuring out the percentage of time, not percent of time here, right? So he's got that notification. So 3 days is how long the clinic's going to last, divided by 260 work days. If we do that, that's going to give us 1%. So that should give us 1%. So we need to just, if you put in the 1 here, then automatically this should have filled in for you to give us the total salaries attributable to this program at $1,300, right? So
I
that
got 1.15%.
you got,
Divided by 260?
yes, that is. That's interesting because he has 1%. This is his answer key. So, all right. So if you're at 1.15, because that's what I would have got too. So there you go. Okay. So let's put in 1.15. There we go. Is that better? Does that match everybody what they got right now? Did everybody else get 1.15%?
Yeah.
Okay. All right. So here's our total salaries attributable to the program is $1,495. And then when we get into the next tab, Social Security and Medicare. So if we take our salaries from the other page, right, the sum of the salaries from each, and remember we had to add those two together because it gave us like the 6-something% and the other 1-point-something%. That's a total of 8. Should be 8.65. Is that right? You know what? This might be the one where he was off. I actually thought I caught this because I think, oh, maybe I did change it. So so you needed to add the 6.2 and the 1.45, right? That should have been 8.65. Okay, he did do that one right. There was one of these that I saw when I was going through it earlier that it didn't seem like he had added them up there. So we can say equals sum of the salaries from the first page, right? So we're back to this, the sum of this whole thing. And then we can multiply it by 0.0865 because that's 8.65%. And that should give us the amount of payroll related expenses that we have to use for Social Security and Medicare. And the workers' compensation, again, from our first page, the instructions was 3%. So if we summed up the salaries on the first page times 3%, I mean, the salaries times 3% and add those together, that should give us a total of $44.85. And then our health insurance premium, this is off because it should be 1.15, is that what we said? 1.15. So in this case, we're taking that 1.15% times the 18,000. And then we multiply that by 3, right? Because each employee is 18,000. So we get that. So total payroll related expenses should be at 795.17. The mileage reimbursement, of course, this is 24 times 3 times 3, so it's times 9, and then times the mileage rate that we have there, which is the 57.5 at 0.57.5, I should say. So that's a total of $124.20. And then the supplies that they gave us here, right? We know that that's 1898 per dose times 1,000 doses, but we already figured the total on the first page. So we just had to put in our actual supplies that we need. And so here's our total consumable supplies at 19,636. Then if we look here, the indirects, we have to compute that at 21,574 times 30% gives us a total indirect cost of 6,472. We actually have to pay. And then I think that's the last one that we had to put in here. So if we jump then to the summary sheet, which this is nice because this is the kind of sheet that you can print out, right, and hand to somebody so that you have done all the different tabs on your work page, right? So notice all the things that we've been using today have just multiple tabs under the same sheet. So you have all of your things in one space, which is really nice. And then you can make your actual summary sheet that puts all these things together, and we can see what all of our different pieces are. And if we need to go back and look, right, this is what people want to look at as a whole. But then when somebody has a question, if you have the work, you know, your other tabs that you can go back and say, well, this is how we got to that amount. You know, we took the 3 days for the clinic divided by how much they actually make. And that's how we came up with this cost, that the salaries would cost us this and that payroll expenses. So there's our total cost that we're talking about for here. And so again, that's a good like financial type report, one of those documents that we're looking at. And then if you click on that last tab, it brings this forward for you that's carried from our costs divided by the 1,000 people that we're going to give injections to. So the cost overall per injection is 28.52. So that's what we want to charge the company that is having us come. We're going to need to be reimbursed at 28.52. That will cover the cost for us to provide that service. So this is just a really useful tool to help us walk through for any of you who have, you know, sources of revenue where you offer some sort of service, and how do you get to the part where you know what to charge. This I think is sort of useful for us to be able to get to that part. So did anybody have any questions as they were going through being able to put the information into the right boxes?
I just noticed a math error under supplies that I think gave us different numbers at the end. For the vaccine. So if it's 1898 per dose, it would be 18,900.
Yeah, should be. Yeah, he doesn't have a formula in there. But we use formulas, right? So gotta love it. Here's what I love about Excel, like using a workbook though. When something doesn't line up, you can just you can click back into cells, right? And figure out what you did. Can you imagine in the old days when we had to do this all by hand? Right?
I definitely wouldn't be doing any of it because I make a lot of mistakes. So
well, and that's just it. I mean, humans make mistakes anyway, just like this, but at least we're not making math errors, right? I mean, Excel will do the math correctly if we tell it to do the right math, right? So that should match up now. So does that help everybody? Are we on the same page now? So now how much do we have to do? 28.71.
that's what I have.
Okay. Okay, good. So anybody else have anything else? Did we catch anything? It was really funny because when I was going through this information for both of these classes is just an online training. So like you just watch it at your own pace. And in both examples, he must have used it more than once. So what was on the screen and the numbers that were in there were not matching what he was saying. And I had a really hard time trying to keep up with what he was trying to talk about because it didn't line up. So when somebody says one thing, and so it's sort of like that, right? We had the different the numbers here, and so then you get confused really quickly. And part of that is because as we start plugging in different numbers, like we want to say, okay, well now the price of this, the usefulness of this is, so let's say we used it for the clinic this year. right? And next year they want us to come back for the same thing. Well, if we haven't changed, if we changed our employees, you know, the salaries here, so what if they got this pay increase? We could just pop that in there, right? That's super simple. And then, but what if like the vaccine had gone up? What if it's now $21, right? So once you create one of these things, then you don't have to start from scratch every time, because Excel allows you to just pop in the numbers. And the beauty is it goes across every one of these tabs. So if we make a mistake in one, we don't have to, like you would in the olden days, go back and change every single piece for it to carry over for us. So again, I think the more we can set up tools that we can just keep a copy of something like this, and then, okay, we want to do this, and then that's just your clinic sheet every time, and you just throw it in there and what changed. Mileage reimbursement. I mean, all these things are changing costs, right? You can't just be like, okay, this is the clinic, we're going to charge this. And that's part of where we get into, we forget how much each one of these costs could seriously change the amount we need to be charging for the service, right? And you're going to have to justify to them when they ask you next year to do this. Okay, and so they say, well, last year you charged us 28.71 cents per person, and this year you're charging us $30. What's the deal? And you can just say, well, look, here's the thing. This is my 2 nurses. Or maybe you get in there and you realize that 2 nurses wasn't enough to get it done in the time frame you needed to get it done. So you have to add another nurse, or at least part of the time have to be there. So once you get these things set up dependent on what your program looks like, then you can just go back and use them over and over and over again. Or at least that's my hope. All right, so thank you for going through that on your own and catching the mistakes along the way, which is always good. All right, so let's talk just a little bit for today, which I know we're probably tired. This is a lot. So what I want to do, I think I have this on the last sheet. Maybe not. Yes. Okay. So the budget narrative. So next week we're gonna look at some financial indicators. We're going to look at ratios. We're going to talk about trend analysis. We're going to talk about projecting our budgets into the future, some forecasting. We're going to look at how to calculate some ratios that are super simple, common things. We're going to talk about what they call KPIs, right? The key performance indicators that may be useful for us in public health. And then we're going to talk about creating a dashboard. We won't really get into doing that so much, so maybe a little bit just to show you. I have a couple outside sources of things that I've used in the past to get my feet wet about creating the dashboards and how you would go about making those interactive. Especially that's why I'd asked the question about who had access to Office 365 version of Excel, because it has what they call the Power Pivot table. So if any of you have used pivot tables in the past, you know that once you create a pivot table in chart, it can't change, it like freezes it. So in Excel, what we just talked about was being able to change the numbers and then it updates for you. But once you turn something into a pivot chart or table, then that information is frozen and you have to make a new one. Well, with Excel's new Power Pivot, you are actually able to create those same type of things and they will update over time. And it's pretty complicated, not complicated, time consuming, I should say. To learn how to use that at an efficient type rate. But I do have a couple of places that I found that were really interesting and have some exercises to help you walk through it. So I do have those resources for you for sure for next week. We'll just play it by ear how much of that we get into besides just talking about the usefulness of what they are. So those are the kind of things that we're going to talk about next week, but also the budget narrative. Okay, so today I'm just going to pull up a couple of these so we can look at them and be thinking about it. So next week I want you to have your budget handy and look at to see again if you have applied for grant in the past. Did you include the budget narrative? Like, was it detailed enough? And also, if you didn't, or if you weren't the person that wrote the grant, like what would you be saying if it was your turn to say it this time? So you do have, I do believe that's in here, even though we won't talk about it until next week. I think that there are 2 in here. One is called the sample budget with justification example, and the other one is the HIV prevention budget narrative. So I'll start with the sample budget justification. And they all look different. Okay, so it's not like there's a one size fits all kind of place here, but this one is just, this is a match required. And so this is the detailed budget period. So here's the personnel. Here are the people. This is the request that we're doing. Here's their level that they're paying for, how much the cost is. So you're figuring out this. And as notice that there's this director that's in kind, because this person, let's say, is paid by the health department, right? And is overseeing all these different programs, and that's that person's job. But technically you're not giving her any money out of your grant. So that's an in-kind contribution. And I know some of you are working in that kind of situation. So how much total is that going to cost us for the salary? Now, here's the part, that's the dollars, right? That's what you're putting in that actual grant application. But then you have to have this justification. And this is where the devil's in the details, right? So depending on the kind of grant you're writing is how much you actually have to include, and then how much further you have in some sort of leeway to doing that. Here's what the roles and responsibilities are. Here's how come they're going to do it. Notice there's 540 clients specific, back to that documentation. What have you used? What are we doing to justify the cost that we're having, that we're seeing right here? Okay. And then we look at this. This is the non-match. Right, here's the pieces that go with that, and what does that look like, and how much will that be? And it has even included the rate per hour and how many hours to get to that point. Again, more justification here. So just, for you guys looking this week, here's the amount of the federal request, and this is the non-federal match that's going to go from that. And here's our, don't forget the fringe, right? We want to make sure we've computed this based on the actual numbers that we needed for the most recent year. And what does that look like? So one of the reasons, I can't remember where it was, even our travel, like what are we doing here, and how can they, it's a mandatory meeting that they have to attend. So, okay, there we go. We put that in there. Here's our airfare and our hotel. So all those pieces that we've looked at over the course of the last 2 days, those will end up in pieces in your justification. So, we're not just doing this stuff for the sake of doing it. We're adding these things in as a reason to continue, not only to sustain the grants that we're getting when we have to reapply for them, but we can use that information also to look for outside sources of funding and different sources of revenue streams or cost cutting measures or whatever. But, if we start from the very beginning and say, okay, here's what we're doing, here's where we want to go. Do we have the information that we need? Did you walk into this program? Are you still getting your feet wet? Have you been there a while? Have you taken a step back? Have you looked at what it is you're going to do the next time you have to apply? What are the outside world looking at? Next week, we are going to talk a little bit about macroeconomics. I know I'm pretty excited about that, but really just seriously looking at some useful, those financial ratios that are really simple as far as formulas go, but can be really useful to keep us like thinking, okay, wait, this is going to be a problem area for us. When are we going to hit? How much farther? And when we start looking at projections, if we're doing okay right now, are we going to come up based on what we can project our costs and our revenues are over the next 3 or 4 years? Are we going to run into a problem? When do we need to look for more funding than what we have now? Do we know that funding is going to increase or decrease, right? And of course, and if you're looking at some sort of state funding or something that matches the revenue streams, I know all of you in Montana have to be concerned about every other year, right? I mean, because every time it's legislative session again, then you're back to that. And so, and you also know that for the most part, then you're probably stuck with whatever you were given at that beginning of that year, whatever those changes are until the next legislative session. So we have to take into account all those things that are both political and financial, and what the climate is like for public health, which again, I know is overwhelming because it's, unfortunately, we have to look at some of these business indicators, but the reality is we're not a business, right? We're providing public health services. And so we can't, it's not as easy to start to look outside of our organizations and think about the world around us that's going to impact the things that we're trying to do in public health. Just, for a silly example, like when COVID first happened and, we were out of PPE, right? Like nobody was ever thinking about that on a regular basis, And so it changed not only what you could do or how you could do it, but how much it costs in the long run to be able to get back to having that kind of material. So, it's really important for us to keep a finger on the pulse of the world, and it's not easy to do so. So we want to start small and inside of our own programs and projects, and working with our leadership and management. And how do we collaborate across different divisions and departments? Is there a way, maybe not even to go outside of our organization, but to look inside our organization to see where we can team up and cut costs? And, I know some of you are using personnel that work in, this grant only funds them for 20% of their time, and you can fund them over here for 20% and over there, so that they can finally have, an actual full-time employee. So I realize you guys are doing a lot of this already. So that's one example of what that looks like. And then the other one is the HIV prevention. And see, this one is a lot more detailed, right? Because it gives a lot more information as far as the job descriptions, right? But it just sort of says, okay, here's the percentages of time they're going to give it to it. And then it just calculates this in the corner. So notice they're different as far as like the outline of how it looks. But this one is good because it does really justify. It's not just like a one sentence type word into what's being promoted here. And it's following a very specific protocol for this HIV programming funding. And so part of what you need to do is say, okay, what is required? You always want to have the justification. And again, those words are used interchangeably as far as budget narrative, budget justification. How much information do you have to include? And I'm not saying that you don't want to be super specific, but be careful to remember this. Whatever that you say here you're going to do is what you have to do, right? That's the number one rule of managing a grant. And so you want to say what you're doing. That's how you get the money. Again, I'm not suggesting that you hide information or what your stuff is, but make sure that what you're putting in there is what you can deliver, right? If you're going to say that this position is responsible for doing X, Y, Z, then when it comes to that money, that person has to be responsible for doing X, Y, and Z, okay? Otherwise, you're going to be in trouble with the grantor when it comes to giving your reports, giving evaluations, when they're coming to oversee, when they come on site, and they're saying, well, hey, here in your narrative, this is what you said you were doing with this money, okay? So number one goal is make sure that whatever you're doing, it matches this. So if you're getting ready to do a new one, if you got to apply again, make sure you're doing that. If you've done it in the past, probably go back and check. Did you just throw in some fluff and say we're using these people for this? And again, I don't mean anybody does that on purpose. But if you're not used to writing that in the grants, like if that's something new to you, or if you're not the one who did it, right? For some of you, I know you're not even the one who applied for the grant, so you may not even know what it says. So that's never good, right? So that's the second rule of grant management. Make sure you know what's in the grant, not only the grant itself, but what did people say when they applied for the grant that the grantor is actually going to be holding you to, right? So again, just if you sort of look through these and pull your grant out, your budgets themselves, if you were writing a new one, next week I'm going to give you some time to think about what would you include in that narrative, what would be the same and what would be different if you were going to be able to reapply for your grant. So it'll give you just a little bit of time in class during the webinar next week to be able to do that kind of a thing. Okay, so that's both of those things for today. Does anybody have any questions on how many of you have worked on budget narratives before?
Lauren has.
Lauren has, I would say, okay, good. Lauren has. Anybody else? All right, well, Lauren, you'll be able to check, double check on your budget narratives. And the rest of you, hopefully it will be something new that you can, like I said, if you have your budget that you have currently, and again, you won't have to put it up to where anybody can see it but you. But also, if you have a grant now that had been applied for, that there is a budget narrative to go with it, then that would be good for you to sort of look over and compare based on the budget that you have and see, was it what we would consider weak. You know, I mean, is there a lot of information there? Did they just fill in the blanks that they absolutely had to? Was there no justification included at all? What would you change, you know, in the process? And be thinking about in terms of, when is your grant up? When do you, are these things that you're going to reapply for? Are they things that are just given to you? Do you actually have to put in that budget narrative, or do you just wait for the money to show up and hope it comes your way, right? And if so, do you know if there's any changes that are coming that would make you have to think about some of the rest of these things that we've been talking about? Does anybody have questions?
I don't think so, but thank you.
Okay. All right, so I think nobody has any questions, and it looks like we're just about right on time.
Very
So,
nice. Thank you so much. Thanks, BRAD. That was a lot of information. I love the Excel sheets. They certainly helped me so much to actually work through stuff. So hopefully everyone, they're not spinning with numbers right now. I will be back on, of course, next week as well for our part 3. And just thank you so much, Trisha. That's a lot of information. I don't know how you keep it all straight. So I certainly appreciate your wisdom and knowledge.
well, like I said, it's great. And I've used a lot of outside resources. So that's, I hope that's the number one takeaway here is just, Google can be your friend. And you have, but here's what I feel like today, especially, part of the training, I was able to use some other people's resources, but I got to prep. I had time. I mean, that was the thing, when you have me to come do the training, I spend the time going through all the different sources because some of them are not useful at all. And some of them are very useful. And the amount of time that everybody would have to spend trying to get to the right information is really, it's because some of it's out there, but it's just very, like I said, you can't just Google health department budgeting. Like it doesn't, there's no such thing. So it's just really interesting. It makes me want to stop and write the book on all of these things.
Seriously.
It would be so helpful if we could have something that was.
We thank you for your work and making it simpler for the rest of us.
Like I said, I'm hoping that it is useful because
Lauren says she'd buy it. Yeah, okay. I think you'd have a lot of people buying that book.
So anyway, it's like I said, it's been fun so far, and hopefully next week we'll do the same thing, and we'll get to do. There's a few more in-class exercises that we get to work on next week too. So
awesome.
I will see everybody next week.
Thanks, Trisha. I'll see everyone next week too.
Bye.